We'll call to order the Board of County Commissioners meeting for April 7th, 2022. We have two items on the agenda today, and Mr. Burton will explain the scheduling and the reason for our meeting today. Did want to note that Commissioner Long had a medical appointment this morning and hopefully will be joining us for our workshop. Item number one, utility work. Mr. Burton, good morning.
Good morning. Good morning, Commissioners. We did something that we normally wouldn't do, which is to hold a special meeting to address these two items. These items are a result of including about $11 million of utility work in a FDOT contract. FDOT's process, though, is a pretty extended process, and because of that, they needed this passed by the 11th, or they were concerned they wouldn't be able to get this out and completed before the beginning of their fiscal year, which then in turn would delay their project by several months. So it was at the request of Secretary Gwynn that we brought this forward, and I contacted our chair to see if we could accommodate them by doing this here today. So we have two items on. Megan is here to answer any questions regarding those items, but this is a result of us having to move utilities for their construction project.
Are there questions? Commissioners want to see a further presentation. Commissioner Seal.
I assumed that these were already budgeted.
Megan, come on.
And then we've been
Yes.
anticipating this
Yes,
project
they've
a while, but
been working
it's a
on
lot
these for a while.
larger than I was anticipating.
These are very large contracts, but I'm sure they've been working on these for some time, but I'll turn it over to
Yes,
Megan.
hi, Megan Ross. Yes, these projects were planned and budgeted in coordination with FDOT.
Yeah, and if you could just briefly, since we're talking about significant dollars, sort of briefly describe the projects with, just tell us what we're talking about. You answered Commissioner Seal's question that it was part of the budget, and then maybe briefly talk about the change from what we're approving today to what was originally planned in terms of cost. So we can get a sense of what those kinds of capital improvement dollars are really, how they're changing in time. So, thank you.
Yeah, sure. So this is a FDOT-driven project, and it is involving improvements to US Highway 19 from 580 up to County Road 95. And as part of that, whenever FDOT makes any kind of improvements to roads, if we have utility pipelines that are in the way, whether it's water, sewer, reclaimed water, we have to coordinate closely with them to ensure we can relocate those pipelines to facilitate those project improvements. And so that's exactly what we're doing in this case. And we also take advantage of the fact that if we need to do any upgrades in those areas, we can sometimes advance those upgrades to coordinate with that work, so we don't have to tear up the road twice. So I believe there was a minor change. We did add some valve upgrades that weren't originally planned, but they were leaking, and we identified those as needing to be upgraded. I don't have the specific amounts of that piece of the project, but I can get that for you.
Okay. And if it wasn't for the project, we wouldn't be having to relocate, is what you're saying? Because the systems themselves
Yes.
are in adequate condition.
Yes, so the systems are in adequate condition, and as with many road projects, it's simply just relocating to facilitate the road
Right.
project. But we do take that as an opportunity. We may have a planned project for that particular pipeline, 5 years out, but if they're doing a road project, we may advance that to coordinate with the roads being torn up and MOT, so that we can just get the benefit of getting it all done at one time.
And this is coming out of our, which account? This is water?
Yeah, this is our water and sewer funds,
Okay.
our enterprise funds.
Yeah, and since it's been planned for a while, what were the original estimates on these costs? Have they gone up significantly, or are they kind of holding their own versus what we're approving today? Do you know?
I don't believe they've gone up significantly. I think they're pretty consistent with
Okay.
what we planned, but I do know we added some
Yeah.
valve improvements that weren't originally anticipated as part of just the relocation piece because the valves were
Right.
faulty and leaking. So I can get that specific number for you,
Okay.
but I believe that was the only change.
Okay, well, thank you. Appreciate
Yep.
the information. That's for both of these, right? 1 and 2?
Yes.
Yeah.
Further questions? All right, we do have two public comments on this agenda item. First, and this is on the agenda item. This is not general public comment. This is on agenda item 1. First up is David Ballard Geddes Jr.
Hi, good morning, Commissioners. David Ballard Geddes Jr. I live on Georgia Avenue in Palm Harbor. I question, are our roads in the process of being transferred seen as a multi-phased, staged, or upgraded traffic control plan? Is this a bid to change and privatize our roadways using a redevelopment scheme, changing our utility road system into a facility road? Are our roads being privatized into becoming a third-party toll road system like our water supply has become, using the reclaimed water availability fee as a toll charge against my water supply and rate? Will this redevelopment, reconstruction scheme not be seen in the future as a public-private partnership, but shall be seen as the aiding and abetting of an internal third-party uprising, whereas the utility is being used to give rise to a third-party facility toll road system throughout? Is the county playing a game of monopoly? I feel the leadership qualities of what's taking place here with financing of our roads moving forward in the future are in question. Thank you.
Thanks, sir. Next up is Greg Pound. You'll have 3 minutes to address the board on item number 1.
Yes, Greg Pound, Largo, Florida. I want to speak on the issue of being able to move or travel in Pinellas County and on our roads. I was over at Wesley Chapel yesterday, and they're having the exact same problem with their county commissioners, is that they're so crowded, just like the same thing, they have the same problem here in Pinellas County, and for some reason, they're not listening to what the people are talking about when you're building more and more and more apartment complexes. Like the mobile home park they just sold down here on Seminole Boulevard in Almerton, just a little bit south of the mall. That huge mobile home park, they went in there, bought the whole thing out, and now they're gonna put apartment complexes in there. And they're gonna pancake us. It's like the lady who was at the meeting probably about a month and a half ago, the lady from New York. She said, this is gonna be like Manhattan. She said, when you flush the toilet, it comes out the sink, because there's so many people there, they can't deal with it. And so that's why we need, our County Commissioner Karen Seal has been over construction projects for years, and you guys know that. She deals with that whole end of the deal. And so what happens is that in the money laundering that's being done for these people to come in and to buy up property and then go ahead and just, everyone in here, we have to drive in this county. Just try driving and see, and you're gonna keep building, you're gonna keep selling us out, and you're gonna keep trying to improve the roads. You're gonna have to get everyone in a helicopter or an airplane to get from point to point, because the roads aren't gonna do it. And so by you keep putting our money, taking the people's money and trying to improve something, that's not gonna work. And so who's getting rich? The contractors and all the kickbacks and the silos that you've got all set up where all the money's being moved and shifted around. And, people who know what's going on in the system, like David and others, we try to hold you accountable. We try to appeal to you. It's like, Florida's no paradise anymore. It's like, it's becoming an illusion. You come here, you think people come here, they live here and they see what's about, then they hurry up and move out. And that's why we have such a turnover in our real estate. Is they come here, they find out this is not what it's cut out to be. And so I would just like to encourage you, if you could start thinking like you live here. Not like when you get so much money, you're gonna move out of here. You know, there's people who live here. And so we'd like to try to encourage you that, you know, there's something more important than money, it's called truth. Okay, and so it's like, out of all these road contracts, nothing's gotten any better, you're gonna keep, like I'm saying, you're gonna have to figure out something different. But I mean, it's like when you start selling out mobile home parks and you allow these big contractors to come in and put these high rises in.
Thank you
and
for your time.
You're overcrowding us.
All right, we have no further comments. Is there further questions, or is there motion? We have a motion from Commissioner Flowers, second from Commissioner Gerard. All in favor say aye. Any opposed? Show it passes unanimously. Item number 2, Mr. Burton.
We gave you an overview of both items.
All right. For questions, further discussion, or is there a motion? Motion by Commissioner Gerard, second by Commissioner Flowers. All those in favor say aye. Any opposed? Show it passes unanimously. And we will now officially adjourn this meeting and take a 10-minute recess.
It didn't used to be that way. We used to make DOT like pay for the
Oh,
relocation.
really?
Yeah, then about 10 years ago, they
He started questioning.
call to order our work session agenda briefing meeting for Thursday, April 7th, 2022. We've got a full agenda, so we're glad you're with us this morning. And we will start with item number 1, COVID-19 lessons learned. And Mr. Administrator, good morning. Kick us off.
Good morning. Well, as we've talked about several times, we went through a lot over the last several years, but when you deal with something of this magnitude, it's always an opportunity to do a lessons learned and to really learn from the experience we have to how to improve for the future. And so Kathy has taken on a very deliberate process to receive the input of all of our community partners, do an evaluation of the things that went well and things that we can improve upon. And she's here today to give you a COVID-19 lessons learned and an opportunity for where we go with this and how do we use this information to improve in the future. So with that, I'll turn it over to Kathy.
Thank you. Good morning, Commissioners. So over the past 2+ years, we've certainly faced an unprecedented event that really pushed us to be resilient, creative, and persistent. What often seemed like a race in the early days is trying to figure out what the pandemic was doing and how we could combat it. It really stretched into a marathon that required a community-wide response and tough leadership decisions with little and often changing information. Over the course of time as a community, we fulfilled over 5,500 resource requests, conducted over 2,000 coordination calls, provided 250,155 vaccines to our community, and did over 308,000 tests to people that needed assistance. And we had over 7 million website hits to our COVID pages. The tragedy, unfortunately, of over 3,000 lives lost in our county and an unknown number of people who've been impacted in so many ways by the pandemic. We sent you a copy of the COVID After Action report that goes into greater detail than I can cover here this morning. But as Barry mentioned, I do want to be able to walk you through some of the key areas of strengths and areas where we do have opportunities to improve and do more. Overall, I would say there were no really big surprises. Many of the items identified are things that emergency management and many of us work on year-round as we strive to improve and continue to work on. And a number of our items during this pandemic were beyond our control. There were certainly things that we could not foresee. We couldn't control decisions that were being made internationally, nationally, at the state level. And there's certainly insights that were gleaned through going through this worldwide event. So just very quickly, I want to kind of walk you through the timeline. If you remember, the very first patients were discovered in Wuhan, China in December of 2019. And in 2020, January, the CDC confirmed the first case in the US, and this was kind of like a freight train. We could see it coming towards us, but we couldn't figure out how to stop, and we had to figure out how could we maybe slow this down. By February 2020, coronavirus disease was given the COVID-19 official name, and then in March 2020, things started to evolve very quickly. On March 3rd, we held the first executive policy meeting group and a rock call. The state of Florida emergency management, the state of emergency was declared on March 11th. On March 11th, also, the World Health Organization declared COVID-19 a pandemic. FDAM started issuing visitations to the healthcare facilities because they knew early on this was going to be impact for them. And then we saw our first cases in Pinellas County. By the 13th of March, the president had declared a nationwide emergency, and the Pinellas County Board of County Commissioners declared our local state of emergency. And today I want to wish you a very happy anniversary. Today is the 2-year anniversary of your first virtual BCC meeting. So we're just missing Brian Zumwalt to officiate and be our monitor for that. And I think we still have a habit of continuing to be on mute even when we're on these calls after 2 years. So I kind of want to present to you the timeline of what COVID looked like, because in the early days, as I mentioned, it really seemed like a race. And I remember 14, 15-hour days and just numerous meetings and just trying to figure out how do we get around this. And it really was because there were so many unknowns about the pandemic and how do you combat it. And we had the insight, unfortunately, of seeing what was happening in China, what was happening in Europe, how it was evolving there, but knowing that that was going to be coming towards us. And we really did start to look at what were the world and other community leaders doing within their communities to try to figure out what those measures would be. So very early on, by March 13th, I believe, the state started to implement state restrictions. And then very soon after that, the county followed suit. So a lot of times we were following the directives of what was happening nationally, statewide, and then trying to implement that here locally. And when you look at what was happening, so we had the global pandemic be declared, the federal disaster declaration actually started a couple of days after ours, Florida State, and then us here in Pinellas County having our local state of emergency. And then we started to implement some additional restrictive measures, closing of the beaches. And then by March 26th, I know that, you know, the emphasis was on how do we start to look at safer at home, and then how do we start to navigate this here locally. And then we lifted safer at home by April 26th. So there were a lot of things that were done initially as we didn't have a lot of information about the pandemic, and then we started to reopen. The state started to meet on what their reopening plan was be, as we were also doing that here locally. And really, if you look at this, the tools in the toolbox that we had until the vaccines came out, which was, I believe we got the first vaccines on December 19th of 2020. So we really only had masking and social distancing as tools in our toolbox to be able to try to reduce the spread. And this was long before the peak of many of the cases that we have. You know, one of the things that I know was talked about a lot was the data and looking at the data and the analysis. And I know at one point, I believe it was 5% positivity rate for cases. But if you only use that as your only data point to make decisions, if you look at what happened in Omicron, we were well up over 30%. So it was really critical that we had to look at holistically what was happening in our community. And certainly we saw unprecedented numbers and impacts in our healthcare facilities. So some of the things that happened, I broke down the after action report into different areas to try to make it more digestible. So the first area just looking at is the policies and protective measures. And early on, we met very frequently. We had a lot of conversations. We brought the subject matter experts to the table to be able to discuss what was occurring, what was happening in other places as it was coming towards us, and what would be best for us to do. The data dashboard was very helpful, trying to collect information and be able to digest it. What was happening in terms of positivity, and if you remember in the early days, testing was very limited. So we didn't necessarily have a full picture of the impacts of COVID as it was impacting our community. Making sure that we had policies in place to help with remote work. And that's one of the things, the county actually now has a county work policy to be able to allow county employees to work remotely. I think that has been tremendously successful. The integration of technology. So we actually saw building officials doing virtual inspections. We saw animal services doing similar things. So there's a lot of departments that implemented technology into their practices on a daily basis that I think have truly benefited our ability to conduct daily business. The global supply chain, this was something that became very critical and became very clear that there is a huge reliance upon raw materials and manufacturing happening in many places around the world. And it became a global competition, and kudos to Joe Loro and his procurement group for really helping us to try to find appropriate PPE that was out there. There was certainly a flood of PPE that came out that was subpar, did not meet health and medical standards. And the ability to be able to get that PPE, sometimes it came down to whoever could execute that purchase order the quickest to be able to secure the items out there. The transition from emergency to normal operations, I think this was a challenge too. I think we saw clearly that some departments were still very busy in terms of COVID response, COVID activities, and others were trying to transition back to normal. And it became a challenge for identifying staff and personnel to be able to assist. A lot of the volunteers that we have in our community are seniors, and seniors were very concerned about COVID and the impacts on them. So we lost a huge part of our volunteer base during COVID, and that's been very difficult for us to be able to think about how and plan for how we will respond to disasters. And I think the key thing with the policies and protective measures is that we have to be flexible in how we respond. That is really key. And I think we saw that over time. There were many different ways that we tried to approach and address the pandemic, but we have to have that flexibility, especially when we get into these long-term disasters, which hopefully this will be the last one that we have. In terms of the Emergency Operations Center, the implementation and operations that we did a lot of virtual operations, which we were afforded that opportunity because this was not a hurricane. We did not lose communications. So we were able to do a lot of remote operations. Our field operations for our testing vaccine sites were phenomenal. It was a little rocky sometimes getting those up and running. We found it very challenging sometimes to find locations to be able to conduct that, especially as the pandemic wore on. Early on in the pandemic, we were able to use Mahaffey Theater because they had shut down their operations. But as normal operations came back online in the county, we found it much more challenging to find locations that were suitable and people that were willing to have us in there to be able to treat and or test people that were COVID positive. There was some reluctance in the community to be able to support that and be able to have appropriate locations so we didn't end up with traffic control issues or people being backed up. Our county staging area and our warehousing, this was tremendously successful. We worked very closely with the Pinellas County Sheriff's Office. They gave us a climate-controlled county staging area where we could receive all the deliveries that were coming in from the state. And the trucks that rolled in from the very beginning, they'd open the door and you were all excited you were getting a shipment from the state. And I remember they'd open the door and it'd be one pallet. So, the challenge of, even just being able to access and get those resources as they came in. We have now a full-fledged warehouse. We've actually utilized additional warehouse. I think at one point we had 3 different warehouses going on to be able to support COVID operations and to be able to supply, once we were able to get the PPE, to make sure that we had that on hand to be able to continue to support our community partners. The partnerships from COVID-19 were invaluable. There is no way that we would have gotten through this without having all of the community partnerships that we did. Certainly, we have created a volunteer organization, Active in Disaster, and I'll talk a little bit more about that later as well. Both internally and externally, the partnerships that we had, just tracking down PPE, as I said, making sure that we were working closely with our hospitals, with our long-term care facilities, and even our business sector. We very early set up a group to start working with businesses, so one, we could understand what the impact on them might be, but also to see what resources they may have in the community. And we had a lot of creative solutions that came up from our private sector partners. You had a presentation a few months ago, I think, from Matico, who was a group that made tinting for windows, and they shifted gears and they started making face masks. And the face masks were of such good quality that we had some of our local hospitals actually procure that as well. And we had people that would actually call and ask specifically for those products. So it was amazing to see how we had local companies that they wanted to participate, they wanted to help us in the disaster, and it was helpful to them because they could get their business back up and running, bring their people back in. So that really helped as well. A lot of our plan updates. So I think, in the world of emergency management, my staff laughs. They want to get to that point where a plan gets my signature on the top saying that, okay, it's been blessed and it's done. There is no such thing as done when it comes to emergency plans. They are always in a flux, of update. And I think we saw there were quite a few plans that when they were faced with the challenge of being implemented, things needed to change. We needed to update our processes. We needed to look at to how we could do things differently. So certainly that is on our docket of many things to address. As I mentioned, the location and the personnel challenges. We don't have a lot of open spaces that are owned by the county. Being able to have personnel to be able to support that, those are challenges, and being able to have things long-term. And we saw that when Delta and Omicron came back up, we had shut down some of our sites and then we needed to reopen. So we had to be flexible in our response. And it's not always easy when you give a property back to somebody and then they're like, nope, we're back to business. Then we needed to find other locations. And that was certainly a real challenge for us. And we've certainly done a lot of refinement of our processes. I think we saw that there were a lot of departments that were all having to put costs under disaster codes, making sure that our resource requests, that process was down. As I mentioned, we processed over 5,500 resource requests. We've never done that many before in any of our events. So it's really important that we had it very structured, that we make sure we could collect the information and disseminate those resources out to people. And really the takeaway through the work that we did at the Emergency Operations Center and setting up all of these field sites is that those partnerships were extremely essential to everything that we did, and really together we were much better in addressing the pandemic. When it came to our health and medical system, certainly there were a lot of stresses on that system, and I think we're going to see those impacts for a long time to come. Everything from equipment and beds, specialty units, and personnel. They saw incredible challenges. We saw a lot of resiliency and a lot of creativity on their part, their ability to expand their ICU units into other areas. They came up with new ways to use ventilators to be able to support more people as they needed it. We certainly saw the challenges with our residential healthcare facilities, and with 253 of these facilities, with over 16,000 beds in our community, when we started to hear about how these cases were exponentially growing in these facilities, it was of grave concern to us. And then we unfortunately started to see the cases and the deaths start to grow exponentially in those facilities. Having to deal with the increased need for protective equipment, of which many of our smaller facilities did not have regular contracts for that. They relied on going to the store, just like everybody else, to get that. And if you remember back to the days where you couldn't even find toilet paper on the shelves, there was no hand sanitizer to be found. So here we had these critical facilities that did not have purchasing power to be able to get stuff. And even facilities and entities, even in emergency medical services and our hospitals that had purchasing power, many of their vendors limited the amount of supplies that they could get. So it was very difficult to establish those new contracts. So it was very key that we worked with them. We started to do coordination calls with the Agency for Healthcare Administration. How could they help us with reaching out to all of these facilities and helping them? What processes and policies and personnel were they able to put in place to be able to support them? Emergency Medical Services did a yeoman's job, Department of Health, Emergency Management. We all worked together to coordinate and support these facilities. The fire districts were instrumental in helping out with going out and doing on-site assessments and training for the personnel. Many of these nurses in the facilities didn't know how to wear the N95. They had to be specialty fit tested. So we wanted to make sure that we got that education and tools in their hands. We spent a lot of time trying to find what we called super SNFs, the super skilled nursing facilities. There came a real challenge at one point where people were remaining COVID positive and the nursing homes were not taking them back. So our hospitals needed to have that relief valve. They needed to have facilities where they could send the non-acute COVID positive patients. So we worked hard to try to identify facilities that could take people in to be able to have those isolation areas. And these are some of the planning that we want to do as we move forward. One of the great things that the state put in place was having infection control teams be able to go out and go to facilities, walk through, see their practices, coach them, and leave them with a better plan for how they could safeguard their employees and their residents there. So we want to work locally with our hospitals on how do we identify these infection control teams, so heaven forbid we had something like this in the future.
Can I interrupt you 1 second to talk about that? These teams, and I missed the first sentence, the state has created these teams, or they're working on creating these teams?
So the state had them specifically during COVID.
Right.
I think one of the takeaways for us is how do we develop something similar to this locally? And that was a discussion that we were having with the hospitals when we were going through this process.
Yeah, that was during the early days, and I drive, on my way home, I drive right by the facilities in Seminole that were the initial hard hit. And I drove by it every day thinking this was going to be one of our worst case scenarios. And then when we went through the process and we learned how lax some of the infection controls were with some of the employees, and that we talked with Dr. Cho and with ACA about what kind of trainings would they be doing, not only during COVID, but after. So I'm happy to hear you talk about that, but it doesn't sound like the state has kind of taken the next step on it.
I think we should continue to reach out and communicate with the state and the Agency for Healthcare Administration for what stipulations, what will they put in place, how will they help those facilities, but I don't want to rely on them either. I want to make sure that we have something here locally, because I think what we saw is what became the huge challenge during COVID. And with most disasters, you can turn to another community, another state for assistance. We couldn't do that during COVID, right? Because the entire world was having the same event. We couldn't there were vendors that were doing field hospitals, but there were just no field hospitals left. There was no additional staffing to be had. And what ended up happening is that basically Peter was robbing Paul, right? So the travel nurses started to get offered huge amounts of money. So, if you're able to make more money working somewhere else, doing a similar type of job, we saw a lot of people leaving and shifting. So I think it's really important for us to look at here locally, how can we have those teams in place? Because the other thing is I think we could see things happening here long before the state could. And, we had teams that were going, obviously, we would get 911 calls, they would respond. And those first responders would go into a facility and they would see what was happening there. We heard that, Baycare also had lab technicians that were going in and, they would go to a facility and there wasn't PPE available. Those should all be red flags. And I want to be able to, how do we build that in here locally so we can make sure that we identify when there's issues, and that way we can address them more quickly.
Thank you.
Health equity was a huge concern for us in the county, and I think there are always communities on a day-to-day basis that are challenged in either reaching or accessing health services, and one of our goals during COVID was to reach out to those communities, to be able to take services out to them, and we saw that a lot with the pop-up sites that we did with testing and with vaccines and reaching out, and then also the language barriers. We made a very conscientious effort to make sure that we had information available in multiple languages. We worked very closely with our Latin community and our Asian community to make sure that we had translators. We did a lot of Facebook Live events to be able to reach those communities and have conversations, and from everything from childcare to mental health to the services that were available. Those were all best practices, and we will be continuing with that. Personal protective equipment, we saw fire and the emergency medical services switching gear to conserve PPE as much as they could. We would hear stories in hospitals when the nurses came on for their shift for the day, they'd be handed a little baggie with X number of masks that they had to use for their 12-hour shift. It almost became like gold. It was under lock and key. We actually got to a point, if you remember, where Pinellas Park actually stood up a decontamination site to be able to reuse PPE, something that was unheard of years ago, right? Because you would always just put on a fresh mask and a fresh pair of gloves and everything as you saw a new patient. This became a very limited resources. And as I mentioned, our logistics group was key in helping to make sure that we provided that PPE out. We did almost 13 million items of PPE, and a lot of this was supporting, as I said, our smalling nursing homes and ALFs, because when those supply chains shut down, it really constrained them incredibly. And I think the takeaway with this is I think it is important for us when it comes to a lot of these entities, they're not under county government control. They're not under our umbrella, but as partners in our community, it is very important for us to understand what are their breakpoints and what are the solutions to that. How can we help them? Are there additional things that we can have in place and coordination to be able to help ensure that as they start to see that strain in a situation like this, we're able to band together and help them and not necessarily rely on outside resources if they're not available. The next section that I want to talk about is a little bit of our public information, our community response, and the economic relief. I think one of the great things that the communications group did early on was to set up a COVID information page. As I mentioned, they had over 7.5 million hits to that site. Information was key. Right? And there was a lot of misinformation out there. There was a lot of conflicting information out there. Communications has a regional PIO work group. It was very important that we worked very closely with all of the communications officers across all of our entities and municipalities to ensure that we could give out consistent information, have information available. And I remember the late nights, as I'm sure Jewel will remember, as the governor's orders came out, and it was often late on a Friday evening, going through them and understanding what was the order, and then so it was one on what was the order, and then what did we need to follow here locally from a policy standpoint, but then there was also the challenge of how do you communicate that to the public? Because some of those orders, I went back and I was reading them the other day, gives me palpitations, but they were very complex and very specific when it came to certain businesses. And how do you communicate that to the public in a digestible way? Barbara always tells us we should have like 3 to 5 talking points and we need to keep it brief. And it was very difficult to do with some of these orders that were coming out. The working groups that we created, and I cannot thank the entities enough that came to the table to help us. By March 15th, we had identified 15 working groups, and this ended up blossoming into 22 different working groups that really focused on the evolving and emerging issues to coordinate and consolidate efforts. There were days that, I think I would have 18 or 20 calls in a day. So thank goodness for the teams and conference calls, but it made for a long day. But there were so many entities that we needed to work with to try to figure out how do we navigate this. Because when schools shut down, a lot of kids lost access to feeding. A lot of families lost access. So we saw this huge ramp up of demand for feeding resources, opening up sites, doing a lot more. And we also, at the same time, we saw the demand for more of these social services. We also saw the decrease of volunteers and people that normally support that. So it was a real challenge.
But when you're talking about these 22 work groups, some of them are obviously internal, but most of them are external. They're nonprofits, they're hospitals, they're everybody out in the community that they were bringing together to have a community response on this. So I just want to highlight how everybody came to the table to try to resolve these issues.
And I think the disaster-related costs, I kind of joked last year, I think during my budget meeting, that we're now headed into the paperpalooza part of the disaster. Going back and reconciling all the requests, making sure that we're documenting everything as we submit the request to help get the FEMA reimbursement. It's no small feat to do all that. That's a whole nother disaster in and of itself. Ensuring that we have all the supportive documentation, that it's preserved, that it's filed, and it's logical, right? Because most disasters, so if you look at Hurricane Andrew, a Category 5 hurricane, that closed out with FEMA 25 years later. So I don't know what COVID's going to be, right? COVID being a nationwide, every single community. When is that going to close out? 100 years from now? So I don't plan on still being an emergency emergency management 100 years from now. So there's going to be a lot of people that are going to be scratching their heads and saying, wait, what did they do? And why did they buy this? Why were they buying garbage bags? We need to be able to document why we were making the decisions we made and why we spent the money where we did. Federal funding was huge as it came down to help the community, and it was greatly needed. There were a lot of complexities for how it could be utilized, even understanding the guidance from the federal government, who was eligible, what could you spend the money on, and that shifted over time too. Out of that, we saw $170 million through the CARES Act, $189 million in ARPA, $6.3 million through the Hazard Mitigation Program, and the last estimate for the FEMA reimbursements from the county was $19 million. So our ability to be able to stand up supportive services, to be able to help, especially with the CARES Act, to get that out to people in the community that needed it was critical. And I think some of the key points that I think about this response area is we have to keep the end user in mind. We certainly saw challenges when we opened up the vaccines and the huge demand for vaccines early on with a limited supply of ability. How do we make sure that we keep what the end user experience in mind? How do we, again, communicate to the public what assistance is available? How can they get that? And again, there was a lot of misinformation out there. There was a lot of conflicting and confusing information. And I think it's important for us to understand the needs of the community. And again, that's why those working groups were so important, because there were things that we may not even have thought about that impacted the ability for businesses. Daycares, when daycares had to close down the amount of kids that they could have in a classroom, that starts to impact the number of parents that have accessibility to that.
And on the disaster-related costs, because there is a lot of misinformation, I do want to, that was another internal work group. So we had, Ken Burke and his team coming together with our budget staff to have an audit process. So all those decisions were made, right up front, making sure we had checks and balances, and all of it is available on our website. And so we can account for each penny. We had many requests from groups that would want that information, and we supplied that information readily and available, and it all has an audit process to it.
So in summation, I think what we really saw, it was through leadership and through partnership that we made our way through COVID. The staff structure that we have in place countywide was resilient. We've bonded and formed a lot of great partnerships internally and externally. We have withstood the greatest challenge to the county that we've probably had in a long time. And again, I hope we don't have to go through this again. We will continue to update our plans and processes. We continue to seek out volunteers and community support. As I mentioned, the voluntary organization Active in Disasters, we now have 85 different agencies, private nonprofits, faith-based agencies throughout the community that are now part of that VOAD. So we are already talking about what are those unmet needs after a disaster? How can we bring the different feeding partners together? If we're faced with something like this again, how do we collaborate and coordinate more to be able to give us the most effective community response? For large-scale disasters, it has to be a whole community response. And I think that through the work that we did, through reaching out to communities, bringing in partners, the leadership that was provided to us through the commission, we were able to navigate our way through the pandemic. So thank you very much for your support.
Question, Mr. Burton?
Yeah, just a couple other things. Obviously, this is a real brief summary of the overall after action report, but there's so many other issues that we've kind of learned from, even internally. We had to navigate elections where your volunteers weren't coming to assist the supervisor of elections in that, and how as county staff we have to kind of reprioritize the things that we do to shift resources around during that time. Well, that's no different than when a hurricane comes. So how can we capitalize and utilize that same mindset when we're doing that, working with our cities? The same thing we needed to work with them here, we need to do that when we do have what's more prominent, which is a weather event. And so there's a lot of real lessons learned that we need to strengthen and work on facilities, on partnerships, to be prepared for whatever comes our way. And so there really is a lot of lessons learned that we can use to prepare, to better prepare for the future or any type of an emergency response.
Commissioner Long?
Good morning. Gee, it's been so long since we've been in this room, it's hard to remember where to put all the buttons. Thank you, Kathy, very much. And I want to just go on the record to say that I find it extraordinarily remarkable in the world we live in today that we have such an extraordinary, remarkable, qualified, experienced team leading our county, and how invaluable the leadership team meetings were to me personally, just being able to communicate and understand the big picture of everything that was going on. And I do know, I remember after Hurricane Andrew being in a position to, our team was one of the first down there in South Florida. It's an overwhelming emotional, mental, and just physical, exhaustive place to be with an enormous amount of responsibility. And it's just really way too bad that all of our citizens don't have a real understanding of how much went into keeping everyone safe. And I could not be more proud of all of your staff, Barry's staff, and the leadership team, and everybody that pulls together to make this beautiful county the paradise that it is for all of us. Thank you, and thank you.
Thank you, Commissioner.
You're welcome.
Thank you, Commissioner. Commissioner Seal?
I think Commissioner Long expressed it for all of us, but I was actually telling our story to some folks from Texas the other day, and I said it was all about our county staff. It was all about the partners in our community, and that is how we all survived and made it through all of this. But I mean, I am just extraordinarily grateful because everybody stepped up to the plate and then some. And I know how much stress there was, and you guys wanted to do it right. And it was just, it's absolutely extraordinary. So I agree. Thank you, and thank you.
Thank you.
And if I could just add one, because we talked in general about staff, I will tell you the sheriff was there through unbelievable number of hours and worked so hard to assist this entire thing. So big kudos to our sheriff.
Commissioner Gerard?
Well, ditto to all of that. I think it would be difficult to name everybody that did an incredible job. You and Barry and the sheriff and communications, just amazing. And I appreciate it because I was chair that year. That you kept me incredibly informed about what was going on, and those calls really did help that we were having daily for a while, and then, helped us keep that information going out to the community. And I really think it's done an amazing job of solidifying relationships in this community that's going to last for decades. You know, I think it will have long-lasting effects. And have you taken a vacation yet?
No.
Oh, heavens, woman.
That's not true. I snuck away for a week, I think, last June.
No, you deserve, well, I'll say it in front of Barry, you deserve 3-month vacation.
Putting in for it right away.
Just watch the other calendar this year before you go anywhere. Commissioner Eggers?
Yeah, and I think the time you got away was almost like forced to go away because you wouldn't take time on your own. You're an amazing woman, and your department was amazing. I continue to tell people Pinellas County government, but when you peel all that back and you see the individuals that give their heart and soul to the residents of this county, it's just mind-boggling and so refreshing. Yeah, we're subject to criticism, all of us. We don't do things perfectly, but I tell you, there's no lack of effort and creativity and commitment from the employees. And I think that's to be commended. You know, the resilience of our residents is right up there too, what they went through in our business communities and, you know, kind of relying on each other and how to figure out this whole thing. So it's obviously something that the federal government wasn't prepared for, the state government wasn't prepared for, we weren't prepared for, and everybody kind of did their thing to try to make the best of it. And you brought up the 253 facilities and 16, I think you said 16,000 beds. And the testing and the PPEs and the staff. And we couldn't figure out, I mean, in the very beginning, we couldn't figure out why these facilities were being so affected. And yet we found out that staff was coming in with stuff and then it just circulated. And then, you know, not our staff, but I'm talking about the staff of the facilities. Just learning that little piece of information and the logistics that we did. You said that the fire department went out to many of those facilities. I mean, just spending an afternoon trying to spend 2 or 3 hours and getting to 2 or 3 locations. I mean, it's just, again, an awful lot to be amazed by and thanked over. I would also say that the report that you put together, I found it really illuminating. I found it really interesting. A lot of information, a lot of good stuff that I hope that we are, you know, not only it's available online, I'm hoping for our residents, maybe they can start to see that, but also sending it to our legislative delegation and getting it out to others that can see not only what we did, but kind of the report that we put together. And I would also encourage you to, as you do always, to listen to others and what they did and maybe how they can improve too. We can always pick up things. 67 counties doing it 67 different ways, probably in many respects. So again, just continue to encourage that. Also, Barry, we have 500 properties in the county that we're talking about doing something with. It's just interesting that one of the issues that we seemed to have was securing locations, right, for PPEs, storage, if you will, distribution, this testing sites, always responding and trying to, you know, scramble. And, you know, we did the best we could to put them in places. We tried to put them in certain areas that didn't have anything available. Just thoughts about how we can, you know, utilize what we have going forward, you know, kind of like what we're going to do going forward, because that reacting to is just not necessarily conducive to making sure we have something available to us, for us, you know, because it doesn't mean it's always going to be there. These property owners have other things they want to do with their properties. And so I think that's something that we have to kind of look at. I think the communications, logistic, partnership roles that you talked about were just each one of those. And then the follow-up, the audit process, making sure that we were doing everything so that we could, you know, we can show people what we did with the funds that we got. Extraordinary. The area that from my perspective, that seemed to have just conflict, whether it was resident groups bringing forward, and is really not necessarily under your bailiwick, but it was more that health department guidance that was getting it from on high, you know, and then what to do with it. It got to the state level, and then how we interpreted that. I remembered, you know, the highly political topic of masks, and how in the very beginning masks didn't matter. You know, I remember in February and March it was like, well, they're not an issue, and then it was they're a real issue, and then it was, well, we don't have any kind of mask is good, and then we heard that only this one kind of mask was good, and it kind of followed political narratives, and or maybe not political narratives, but it was just frustrating to be able to respond on that. And a lot of that, as you said in the very beginning, it's kind of outside of our control, but trying to figure out how we can incorporate multiple thought processes out there, because as we look back on it, not everybody was right. Somebody here was right on some things, and then somebody over here was right on other things. And to be able to be open-minded and listen to different things that are out there, solutions, I think is something that personally, that I learned through this. It's not just one person that you're going to listen to. We get a lot of trouble that way. But, and then I think the only other thing that I would say is, you we talked about the locations of all of our sites, trying to spread them out a little bit, whether it's in areas that don't have access, as much access to healthcare. But also, there was a lot of people in a lot of areas of this county that just needed help, needed something to be closer to them. So I would encourage us to continue. And I know we looked all over the place, but we got as far north as Ruth Eckerd, and that was a great place to have. But there's a lot of folks up in Tarpon Springs that were kind of out of the loop. But I think this is two things. Just my two final things were that because of this partnership with our cities, I just think it opens up, and I think, Barry, you're already taking advantage of it in other areas, how that collaboration with cities and our city partners was so impressive that we have other areas to work together on, and I'm really glad about that. And then just one last question for you. If just three things that come to mind, the three critical things, the three most important things that if you had to do it over, what are those things that you would identify as the, like, maybe
Other than not being the emergency manager at the time?
Yeah. No, I think some of the comments that were made about how lucky we are to have you and your team at the top with all that experience and dedication, it's just unbelievable. Yeah, so you can't go anywhere, but go ahead.
So I think the top three things are the relationships. If you don't have the relationships already built in the community, it was challenging. I think when we didn't know what businesses had what, and I think working through economic development to even understand, I didn't have a good feel for what do all the businesses in our community do? What could they bring to the table? Who could we reach out to? And during the event, we actually at one point reached out to tattoo parlors, nail salons, dentist office. We were reaching out to anybody. We're like, okay, who use gloves? Who might use masks on a regular basis? So I think having relationships, we have built up a tremendous relationship, as I mentioned, through the Voluntary Organizations Active in Disaster. By knowing who is in your community, who you can reach out to, we have a tremendous level of support in our community. And the pandemic, unfortunately, squeezed that because, we were concerned that we don't want people to get sick by coming out. But having those relationships is critically important. I think always having a backup plan. That's what we do in emergency management. We sometimes throw a lot of spaghetti on the wall and we see what sticks. When we go through our process for any disaster that we're headed into, we do what I call the BMW, right? The best, mid, and worst case scenario. And very early on in March, and I remember in our conference room, and Lourdes was there, we had Dr. Cho, Dr. Jameson, we brought EMS in, and we started talking about it, right? So what is this pandemic gonna look like? And we put our best, mid, and our worst case scenario on. And then jokingly, one of my staff turned to me a week later, and they're like, well, we've already surpassed the worst case scenario, now what? So we have to have contingency plans. We need to have, what is that continuity of operations? Where are the other places that we can get those resources from? And I think that's a valuable takeaway. I think every department, every entity out there needs to look at what are those critical resources that you have, and if you couldn't get it from your number one person, where else could you get it? Or what could be the substitute for that? The third thing I think is support. And I think we certainly saw that from the commission. We saw that from the county administrator. He was always like, what do you need? What do you need? And sometimes I didn't know how to answer that question because I didn't know what we needed. But sometimes it was, I need more people. We need more money. We need locations. And we turned to a lot of people in the county. And you mentioned the locations. I mean, administrative services was incredible. They looked at probably over 80-some different locations to try to find adequate spaces for us to be able to utilize. So it's really important that we have support. I think emergency management is not something that most people think about. Most people don't think about disasters. They don't move to Florida for hurricanes. They move here for the beautiful beaches and the sunshiny weather. And I'm some kind of little rain cloud that comes along. You know, jokingly, somebody said to me today, "Oh, you know, I like it when I don't have to see you." And I don't take that personally because I understand that when I'm here, I'm usually talking about disasters. You know, so having that support day in and day out, we've got to have those relationships in place. We've got to have the support. We've got to have our plans for, you know, elections. When you don't have enough people, or a lot of our polling sites were in long-term care facilities, that was not going to fly during COVID. So we had to recalculate. We had to come up with Plan B. And it was through the creative process of working with so many different people to help come up with solutions.
Yeah,
That made it work.
Thank you, Kathy. And the only other thing I'd ask is maybe, and I know you have the information, but on the page that you showed, the timeline and all of the cases, how they ebbed and flowed, and the information that relates to the number of hospitalizations and/or deaths as they mirrored each one of these outbreaks, if you will. I do know that like the last one had probably the fewest hospitalizations. And the first one, which in hindsight, when you look at it, it's a smaller number, but had a lot more hospitalizations. So maybe we could just to share that, because I think that perspective is really important. At the very beginning, we were flying blind. I mean, trying to understand what was going on and everything, and that kind of led us down that path. A lot of people at nursing homes dying. I mean, that was the number one thing that got our attention and got our responses going, and hospitals engaged and all of that. So that would be helpful as well. So.
Yeah, because if you look at that slide, and if you just went off of cases, you would think that that last wave, which is the Omicron,
Right.
was the worst. And certainly there were more people that were sick, but the severity of it, as you mentioned, was not as bad. Whereas Delta, which was a smaller wave, we saw a lot more hospitalizations, a lot more severe illness. So it does make a difference. And that, you know, goes back to kind of that disaster, that data dashboard, is we needed to have all these different data points coming in. And it was a challenge because how the data was being reported and collected was different. You know, we relied upon the state to be able to get information, and at one point they changed the way they were reporting deaths. And even that, if you remember, became controversial as to was it a death due to COVID or was it something else. So, you know, I joke because I ask a question in our interview panels every time. It's like, what would you do if you had to make a decision without having all the information you needed to have? And when I ask that question now in interview panels, I think that was every day in COVID, right? We never had as much information that we wanted to have, but decisions had to be made. And that's really challenging.
Thank you. Appreciate it.
Commissioner Long.
Thank you, Kathy. I totally transitioning from the lessons learned. I'm hopeful that you can take everything you've learned and give us kind of a scenario of what you know or what you see with regard to the Omicron as it relates to the weather changing in the late fall. Because I don't remember where I read it, but recently I read that the scientists, if you will, do expect a giant increase in cases as the weather turns colder in the late fall. And also that it's going to be important for folks who have had the booster shot to get another one and handle it similar to what we do with the flu shot, getting the flu shot every year. Do you know if that's accurate, or if we have any plans to do that for our citizens, or be a data point where people can get that kind of information?
I would have to defer to the Department of Health. They're, you know, the lead for the vaccinations and monitoring is going on with Omicron. And certainly, we've seen a decrease in cases, and certainly watching what's happening elsewhere. But I would defer to Dr. Cho to speak to that.
I was hoping he would be here to answer that question, because as I think we all are noticing, people have become very complacent about either masking or social distancing, and it's kind of like not even a thing anymore, except in a few places where they are absolutely adamant that you have to still wear your mask. Just saying. Thank you.
Thank you, Commissioner. I just had a couple, it really is on page 35 of your full report, and it's just guidance on measures from federal and state agencies were confusing, sometimes conflicting and ever-changing. This posed challenges for conveying information at a local level. I know the commissioners, and certainly I wasn't out doing PPE, I wasn't out doing, but I was trying to convey information as best I could, and conflicting information, and sometimes it was simply the titles, for example, the Pinellas County Department of Health. So everyone, we heard citizens berate poor Dr. Cho and blame us for his salary and his, everything under the sun when he was a state employee. We also heard it with, as you mentioned early on, the Friday afternoon executive orders that we would try and figure out. And it goes back to the first website the Department of Health tried to set up, which was, not successful, being kind. I asked you about the infection control teams. And I went through, and I love the timeline because I had tried to do this myself, the executive orders. And in the front of the book, there is most of the executive orders, and then in the back of the book, if you get that, is every single executive order, date by date. And I don't want to berate this, I don't want to belabor this, but I would like, just on the record today, maybe the county attorney can help me out, the governor's executive order 20-91 laid out that people of Florida should stay in their homes except for participating in essential activities. And in the governor's executive order, he delineated what was an essential activity. Would you agree with that?
It's been a while since I reviewed that order, but yes, that is my recollection of what that order set forth.
And did this county commission ever vote on what activity was essential or not?
You did not.
Thank you.
You imposed an order that basically was intended to implement that order, which conveyed a list of essential and non-essential, and even that was confusing because it then referred to a federal document, it referred to a document from Miami-Dade, which had been amended several times. So again, to get back to, Kathy's statement about some of the confusion, no, you all did not delineate what was essential or not. You simply referred to the governor's order.
Thank you very much. And again, I'm not trying to belabor it, but as someone who went through some of those activities in 2020 that there was a lot of confusion, we even had confusion among county staff, county employees, county commissioners about who was responsible for what activity. So during this after action report, I did want to go through, at least have that on the record. So I appreciate that. Any other questions or comments? Again, let me add my thanks to your entire team. Being on some of those calls and hearing some of the preparations that you all were making in the early days when we didn't know what was going on, and we thought the spike was going to be in a much more horrific way than it was. Your all's professionalism was beyond reproach, and we really appreciate everything that you all did.
Thank you, Commissioner.
Mr. Burton.
Item number 2, Karen is on her way up, and she's been working very, very hard on implementing the coordinated access model. And so today she's going to provide you an update of where they're at and the implementation timeline.
Hi, good morning, Commissioners. Karen Yachum, Human Services Director. So as Barry mentioned, I'm going to go over a very high-level update for the Behavioral Health Coordinated Access Model.
Is your microphone on?
I believe so. Do I just need to get closer to it? Is that better? Okay. And much of what I'm going to go over today mirrors the update that was provided at the end of last month, but it's just helpful, I think, to walk through where we are. So in 2019, we engaged with KPMG for a strategic plan to elevate our behavioral health system. Again, we did not ask for a study or an evaluation. We really asked for a strategic roadmap that would give us recommendations to elevate that system. A lot of that work really was about community engagement. So we conducted over 50 interviews with community stakeholders to really hear about the successes and pain points related to the behavioral health system. We provided KPMG with 6 volumes of documentation to review, so data, evaluations of studies, pilot projects that we had, measurements from the managing entity, as well as KPMG conducted a leading and best practice review of national and international practices that could be formulated into a plan for Pinellas County. In May of 2020, KPMG delivered that plan titled the Elevate Behavioral Health Pinellas Plan with 2 main recommendations. The first being the optimal data set, which was initiated in October of 2020, and the Behavioral Health Coordinated Access Model, which was initiated in June of 2021. Briefly, I would just like to say that the optimal data set remains on target. We are in the final stages of testing the very elaborate dashboard of our initial 29 key performance indicators and have begun rolling those indicators into our upcoming contracts for behavioral health services. So the coordinated access model is a client-centered and centralized intake system which is intended to streamline access to care for persons experiencing behavioral health issues and other associated conditions using appropriate processes, skill sets, and technology. And really what we were looking for are 4 key deliverables. So 1, initial point of contact to make it easy and seamless for our residents. Clinical assessment and triage to make sure that the service being recommended was the right service for that individual. Live scheduling, which was really the key component. We did not want our residents leaving with a list of places to call. We wanted them leaving with an appointment. And data analytics that will really show not only return on investment, but details about what does access look like in our system daily. So what are the wait times for assessment? What are the wait times for therapy? And really, where are the bottlenecks in our system? Those were some of the questions we could not answer as a system when KPMG initiated their process.
Karen, on that last page, that last part, the data analytics, is that going to include, or are we still anticipating kind of a follow-up, kind of a control mechanism that says where we sent you, where you had an appointment, did the right work? And I mean, is that going to be included in those deliverables or?
Yes.
Yeah, okay.
So what the vendor has proposed, which we'll kind of touch on, is a technology platform that holds the information. So where was the client referred to? And then a feedback loop from the organization that will say, yes, they attended their appointment. And that's really important for subsequent calls. So when they call again, or when another referral source calls again, the CAM has that information so that they know where they were before.
Excellent. Thank you.
Sure.
I have a question. Can we get a copy of the set of indicators that you've settled on?
Sure. And again, for the ODS, the 29 indicators are the first phase. So we focused on access and behavioral health case management. Phase 1 and then phase 2, we will be starting a brand new set of indicators, probably related to therapy.
All right, thanks.
Sure. So I want to touch on the behavioral health coordinated access model timeline. So as I mentioned, the CAM was approved in June of 2021. We held our project kickoff in July of 2021. And the first month or two really focused on gathering knowledge and input from our community stakeholders. It was really important that we did not design the system in a vacuum. So once again, we worked with our community stakeholders. We conducted 3 public information sessions to really go over what the idea of the model was, talk to the public about strengths, challenges, and really what the ideal access system would look like for behavioral health. We conducted 8 expert interviews, so national CEOs, national behavioral health experts, again on our model, what they would recommend from kind of a national standpoint. And then just kind of walking them through our idea just to kind of further validate that this really is the direction we should continue moving in. We also, again, met with several stakeholders, which included the CEOs of our behavioral health partner organizations. We met with the school system, the child welfare system. We met with 211 as they operate the National Suicide Hotline. We met with 911 because, again, that's a high intersection And so we were really looking for systems of care that had a high integration with behavioral health, either by referrals or high utilizers. We wanted to make sure that we were designing the system for the people, but also those systems that coordinate care on behalf of the persons that they are serving. Again, we conducted surveys with the community to ask those same questions as well. And KPMG also did a leading practice review looking at telehealth providers, behavioral health call centers, and certified behavioral health clinics. That's the new CCBHC model that is through SAMHSA, to look at how our CAM would intersect with that. In October, we had fully developed the RFP. We validated that with the Pinellas Integrated Care Alliance. And just as a reminder, that is the funders group that meets to make sure that we are collectively making decisions for the system. That includes the Sheriff's Office, Central Florida Behavioral Health Network, the Juvenile Welfare Board, County Administration, and the Department of Health. We then brought the scope back to the Commission to review this information with KPMG before we launched the RFP in November. The submissions were due in December, and we received one submission from Unite Us in partnership with the University of South Florida College of Behavioral Health Sciences. The vendor was evaluated again by members from PICA, and then we brought them back for an oral presentation in March, and we requested a live demonstration because if you've ever gone through a technology build out, you want to make sure that we're not the start of their program. We want to see the demo. We want to see what they're presenting to us. We may have tweaks, but we really thought that that was an important step in the presentation. So a little bit about Unite Us and University of South Florida. So Unite Us is an industry leader building social care infrastructure across the United States. They are currently in 44 states, and they were founded in 2013. They are currently the state organization for social care in North Carolina. They are the lead for the Virginia Department of Health. They are working with KidsLink, which is behavioral health services for children in Rhode Island, and they are also working with Palm Beach County. And so just for a status update, we are in the process of obtaining references from all of those organizations to make sure that, you know, they are delivering, that they're a good partner, and just making sure that we are taking the appropriate steps to validate who we're working with. The really interesting thing was their partnership with the University of South Florida College of Behavioral Health Sciences. We were really looking for two main parts for our CAM, a technology platform, but also clinical expertise. And so this really was, I would say, a perfect marriage as far as a proposal. USF has been a behavioral health leader for 18 years and has also operated the Florida Mental Health Institute for 30 years.
Commissioner Gerard has a question.
Just a question, are they nonprofit or for-profit?
Unite Us? I'd have to double check. I believe nonprofit, but I'll double check and circle back.
Thanks.
Sure. One of the things that we did not know that USF is conducting is they are actually in the process of delivering telepsychiatry services. So they work with child and adolescent psychiatry, linking them to appointments for children, but also educating primary care pediatric providers on psychiatric services. So it was really exciting to hear that that model brought forth to us because it really, again, married with what we were looking for with the CAM. Another interesting part of USF is there's a natural workforce. So as you know, we're in the kind of great resignation, and that this behavioral health industry has really been hit hard with turnover. And so one of the strategies that USF has brought forth is they have graduates and graduate students, and many of those individuals will be looking for employment upon graduation. And so the College of Behavioral Health and Community Sciences, in addition to the College of Social Work, is kind of a natural workforce strategy that we'll be building through with the CAM. And so now this is where I want to say kind of the real work or the heavy lift really is going to begin. So we will be moving forward with contract negotiations with Unite Us and USF. We will continue our implementation work with KPMG over the next 12 months. And really some of the highlights is integration with the behavioral health provider's electronic medical record for live scheduling, Developing the standardized clinical assessment and triage. Again, we really want our residents to only have to tell their story once. So that's really what we're going to be looking for at the forefront, is how do we collect that information to assist with their next phase of treatment. We're going to continue working on information across systems. So Commissioner Eggers, that answers the question about how do we do that closing of the loop. That's really, really important foundation for this process. Again, analytics for access to care, being able to know daily what that access looks like. And our go live is anticipated for spring of 2023. So that's my update for today, and I'll happily answer any questions.
Thank you very much. I think that in any system of healthcare, whether it's what we're talking about today or that tell your story one time, if you can make that happen, that's especially in what you're talking about, but that's a huge, huge thing for our residents. Commissioner Eggers.
Yeah, Karen, thank you for the update. Just thinking about the world of mental health services and how broad that is, and we have a lot of providers in the community that have been doing it for years. The sheriff has a new program in place. St. Petersburg Police has a program in place. And we have the 1-800-273 number for the, and a lot of hotlines that are out there. So if I'm a resident in the community and what's the difference? Let's just say this was all done, we're a year. What are we getting that we're not currently getting? And what in their mindset, whether they're doing it for themselves or for somebody in their family or a friend that they know, what makes them come to this portal? Like, are we talking about a 511 number? Are we talking about something that kind of, tries to pull all of this together? Because I still see a very, fragmented approach to this, and maybe it'll always be that way. But we're trying to provide that. What is it that we're marketing? I loved your first comment, your first summary about what is CAM, but what are we going to do to let our residents know this powerful tool that will be available for them?
So with the marketing strategy, I think we're really going to be crafting that around the CAM being the first call. So the Sheriff's Mental Health Unit, the call program in St. Pete, the suicide hotline, mobile crisis, those are really designed to respond when someone is in crisis. And I think with what we've really talked about and learned with KPMG is that we as a county system, we focused so much energy and financial resources in the highest utilizers of services. And this is kind of the strategy, I would say, to flip that and to start at the base. When someone is first experiencing a system, when their loved one is first starting to feel depressed, this is where we want them to go. And so I think some of the marketing is really going to be how we are person-centered, how we're making it easy, how we are keeping equity in mind, how we're listening to the individuals and families who are calling. That's really what I think we should be pushing out. I met with someone earlier this week who has a PhD and was trying to coordinate care for a loved one and was struggling. Yeah. And so it's not about education, it's not really about your connections in the community. It should be one call, and one call that can help someone walk through what insurance do you have? Who are the providers in your network? What race of the provider do you want to see? I mean, that's really, really important. And I think that was really what I heard with Unite Us, is that they have, in addition to this technology platform, they have an engagement team that's based in Florida that's really going to be delivering a larger network for us. So finding out who the telehealth providers are, finding out where the private practice clinicians are, building a network of providers of color. I really think that's important. When someone calls in, they want to see a provider that looks like them, talks like them, speaks the same language. I think that's what we're going to be able to push out for our CAM in partnership with our providers.
But if somebody does call in an emergency, that triage or that clinical assessment and triage could end up in a 911 call.
Absolutely. And that's really, I think, when we're looking at 12 months, I know it feels very long for an implementation, But A, we want to get it right, and B, we want to make sure that those systems that are crisis responding can intersect with this. So when someone is repeatedly calling 911 and in crisis, is this an option? Should they be referred to the CAM? Should law enforcement go out? Should law enforcement refer to the CAM? I think those are all the mechanics that we need to work out to make sure that we are keeping our residents at the forefront.
And then the last question I had was really about age and folks that are coming in that might be teenage kids or maybe younger. I mean, they might learn about this access. Is this going to be, is there a certain age restriction that can call in? And then what's their sense of privacy as it relates to, parental kind of things?
So I would say at the end of our full implementation, so not the first year, the anticipation is that we will serve all ages. So our starting base was really looking at that 18 to 64, so adults who are calling in.
Right.
But phase 2 would probably be children, phase 3 maybe seniors. And really working with JWB, working with the Children's, Service Council, we really have to keep that in mind. So what happens when a youth calls in? Yeah. What does that parental consent look like? Because this isn't treatment. This really is the bridge to access to care for treatment.
Thank you, Karen.
Sure.
Commissioner Gerard.
Well, and I think the sheriff, when he was talking about his new units, was not claiming that that was treatment in any way. I mean, this will not be treatment, but it will be connecting people to treatment, and hopefully an emphasis on people who have no resources, no insurance to back that up. Where can they go for help?
Right.
I think it's great if they can direct people to their provider, but they don't have one, and many, many people don't. And these are connections to also long-term services for a lot of people, not just crisis, but, people that have serious mental illnesses that need help on an ongoing basis. So I think, I don't think the sheriff would have any problem deferring to the system once it's up and running. I appreciate his, willingness to get his unit up and running while we're working on this, but hopefully that will be able to go away after a while.
And the sheriff has been part of this process, so he is the member for PICA. So while we work with many of his staff on the evaluation committees, when this model was validated, he was at the table, so he's been very involved.
Commissioner Flowers.
Thank you, Mr. Chair. Looks like we have a tornado warning in St. Pete, so.
It's actually north Palm Harbor, right on the Pasco-Pinellas line, right after Kathy left the building, I think.
Okay.
So.
Okay. It appears from their website, Commissioner Gerard, that they are a for-profit entity. And so, just asking, I don't know if you know the answer to this, but do you know why we may have only received so few interests in putting this model forward, especially since there are so many models that are similar, not exactly the same, but that are similar, that are used throughout the U.S. So would you happen to?
So we had interest. I will say part of what we had coordinated or contracted KPMG for was to kind of garner interest for this model. So we had several agencies that we had interviewed with that participated in some of our early kind of RFP proposal meetings. And when they didn't respond, we charged KPMG with circling back and finding out why they did not respond. So I think the majority of the feedback that we received was they had one component of this. So they had the technology platform, but they didn't have the clinical part, and they didn't have the knowledge of who to partner with, possibly in community or nationally, for this model. So again, because we were looking for both, the feedback we got was it's so innovative that they just didn't have both critical pieces to this, because it wasn't just the technology platform that we were looking for.
Right. And then just looking at some of what they have here online, they're using a two-part system. If a person shows up in person or if a person calls in, then they use, persons can apply for services online or request assistance. So is that, to the best of your knowledge, a part of the system that they'll utilize both in person and potentially online? And a way to track. So if I'm online and I'm applying for services or request services, it goes to whomever, that they will be able to track that, yes, the form or the document went to party B and was acted upon within whatever time frame would be considered, appropriate, 24, 48 hours, immediately, depending on the issue. And then case closed because the person actually received the service. Do you know if that will?
So we did ask them in their demo to walk us through kind of what intake looks like, what the receiving provider would receive, and they are able to push all of their documents to that provider. One of the things that we need to work through with the negotiation piece is that integration. So that wasn't part of their proposal. I don't believe that that's what they are providing in the 44 states that they're working in. So again, even with the one response we received, we are going to be asking them to stretch and build and do even more than what they are previously doing. I don't know that we have thought about what the walk-up model would look like. We are looking at phone calls and websites, but part of what KPMG, I will say, recommended in kind of the Cadillac model was that we would have other ways for residents to access the CAM throughout our community. And I think that that really goes back to Unite Us, their engagement team. So as they're going out in community and meeting with community partners, maybe it's that we're building a hub at that location so that they can access the CAM.
Okay. They allude to Illinois, so if you want to maybe look and see if they're that dual system in Illinois, because that's what they allude to here. And then my last question is, USF has a wonderful social service, mental health, psychology, sociology pieces over there, and excellent college graduates that are coming out of there and going to work in the field at CFBHN and other places. So I am hopeful that the roles will be clearly delineated and defined between what USF expectations are and their collaboration with some of those minority therapists
Yes.
and social workers and things of that nature that are in the community. And while they're not utilizing this model, they certainly have been very integral in a lot of the mental health services that were provided, particularly through the COVID crisis. LaDonna Butler and her team, The Well, and some
That's right.
others, Dr. Carlia East and others. So I'm glad to hear you say that that was a part of the thought process, just in bringing people in and maybe, even looking at who's available, because I really haven't heard much about who might be in those service provision areas, North County or Mid-County. So I am hopeful that when all of this gets wrapped up and rolled up, that we will really do a reach out to make sure that that's a part of it. But congratulations. I know this has been a long process. I know that FAST has really been like next door neighbors to Mr. Burton, consistently going through this. And I really appreciate all the work that has occurred, because it does take out some of those unnecessary steps that would probably prevent a person from seeking services and maybe taking other actions that are more life-threatening to them than when we have this in place, and it can really just jump on assisting them with much-needed services. So thank you to you and your team, and to all of the community partners, if you could share that with them as well.
Thank you.
Thank you, Commissioner. Commissioner Eggers.
I had two questions, and the one that Commissioner Flowers mentioned about multiple different access, I think is going to be important. Just the picking up the phone and talking to somebody online or virtually or may not be the TLC that they need, even for that connection. And I know you mentioned that connecting to services is really a bridge. And I think the sheriff's program, frankly, is that. I mean, they respond to situations out in the public, and instead of sending him to jail, they're trying to connect him to a service too. So I think there's some of those similarities. The thing that you mentioned, I'd like to know more about the phase 1 and phase 2 as it relates to, in phase 1, not dealing with children and not dealing with seniors. And I think about the suicide, and again, I'm not as versed, obviously, but where the suicides are happening, teenage kids is a big area that we have problems with, and so are our seniors, our veterans that are out there that, that served in World War II or Vietnam that have had issues, but we're not, in phase one, we're not touching them. So what is the length, would you anticipate, before we enter phase two and include those age groups?
Because we were still kind of working through the process, I think that that will be mapped out during implementation.
Okay.
My hope and expectation is it's very brief, that
Okay.
it's really about the mechanics, it's about understanding the providers, and, you know, we are blessed in our community. A lot of our providers serve all ages. So, you know, our plan of starting with 18 to 64, it may evolve within the first phase that we're really serving all, because we don't really have a lot of providers that say, I only serve youth. There are some, but really they serve all.
Yeah, I think you'll find you're going to be getting calls during phase one that are
Absolutely.
outside, so we'll have to deal with that along the way too, so, thank you.
Sure.
Further questions? I just had one. At some point, if you could give us a simple chart or listing of the funding sources for the program and who's funding what, who's, at least amounts?
So the CAM itself?
Yes,
That's all the county.
that's all us.
Yes, so
all
when we work with the partnerships, so.
We're talking,
The other funders, it's really kind of us locking arms with them to create expectations in contracts so that the partners we're working with are all working in one direction.
and then remind us what we're spending then on the CAM.
So so far, we're spending the consulting fees with KPMG, which was roughly $1 million. The next phase is also roughly $1 million. The CAM operations was part of ARPA, and we've set aside $1 million for that. But again, we're still in that kind of building phase. What KPMG estimated originally when they first presented to the BCC was $2 million operations.
So what we're building it out with ARPA funds, and then we have it built into our budget for maintaining it going forward.
And then, and if you could put that together on a one pager, and maybe what Central Florida and others are spending on the care after in Pinellas County, I think that would be helpful to see the big picture for us.
Sure.
Anything further? Commissioner Eggers?
You brought the issue of the payment and such. Are these costs that, now that we're setting aside some costs to get the program moving forward, but are these funds that can come from our health millage as opposed to general fund, or I'm just, it's certainly health related, but I was just curious as we explore that.
I'm sure it could. We would have to, we'd have to funnel it through that way to be able to pay for it, but we could, and we have millage amount that we could add to be able to do something like that.
Just curious, that's all. Thank you.
Yes.
Commissioner Seal?
To answer your question, I think you have to contract still with the Department of Health.
Correct.
But
We'd have
then
to
it
run
would
it through
just flow
them.
back.
In the last, just before she leaves, I mean, what they're doing is really, really unique with this integration. And I'm sure there's other model programs out there, but my own experience is that it's much more prevalent to see a referral system, where they give you information and then it's up to you to make those connections. And that's the reason, because I asked the question, okay, we only got one bid, so are we comfortable with this? And they were 100% comfortable because of the due diligence they've done. But again, when you look out, sometimes with my own family member that I was dealing with, I thought it was this, and it wasn't. It was, here, we can tell you where to go and where to access, but it wasn't the integration that they're going through. That's the reason it's taking so long. But the benefits at the end are just going to be so much better as a result. So.
Commissioner Gerard?
Just a question for ongoing. So these things that we're tracking, or the requirement to track those things will be built into their contracts with the county in general? Is that what I'm?
So all of our behavioral health contracts, they'll have requirements in for the first part, which is the ODS, those 29 key performance indicators. We're also building in a performance-based structure. So if they're meeting expectations, we're building in that process.
Right.
And then we are also building in standard language that they will work with the CAM provider so that they will submit their information. But again, I really think a lot of the onus is on the vendor to get that information. So I don't think we should be waiting for providers to update. They need to actively seek out that information to make sure their database is accurate.
Right, but it's not entirely voluntary that they're working
Correct.
with the system. It's built into other things.
Thank you very much.
Thank you.
Appreciate all the good information. Just a reminder, if you're not speaking, if you turn off your microphone, that is what causes some of the feedback. Item number 3, surface water discharge elimination plan.
Well, Megan's on her way up. As you know, last year they passed a bill that requires Florida wastewater utilities to develop a plan to eliminate discharges to all of our water bodies. Today, staff will be presenting an update with our consultant on the impacts of this bill to us. This preliminary plan will look at all of the available options, but will require further studies to determine the feasibility of each one. So again, I'm going to let Megan introduce. We're very happy to have John Truitt with us. He's the Deputy Secretary for Regulatory Programs at the Florida Department of Environmental Protection here with us today. And again, I'm going to let Megan introduce the consulting team and Mr. Truitt as she presents this item.
Well, good morning, Commissioners. Megan Ross, Director of Utilities for Pinellas County. And as Barry mentioned, today we're presenting an overview of our surface water discharge elimination plan, which is in response to Florida Senate Bill 64. So just to provide some background, Senate Bill 64 was passed last year, and it requires that all domestic wastewater utilities submit a plan to eliminate non-beneficial surface water discharges, and that plan is to be submitted to the Florida Department of Environmental Protection. Surface water discharge refers to clean, disinfected effluent from wastewater facilities that discharge into really any body of water. So this includes the Gulf of Mexico, Tampa Bay, lakes, rivers, and creeks. And so practically speaking, you can think of surface water discharge as simply excess reclaimed water. It's reclaimed water that we don't have a demand for in the system, and that's an opportunity of a way to manage those fluids. So for Pinellas County, this specifically impacts our South Cross Bayou Advanced Water Reclamation Facility. Currently, this facility has maintained a surface water discharge permit through the Florida Department of Environmental Protection since 2002, which allows us to discharge excess reclaimed water into Joe's Creek. I would also like to note that this bill does not impact our William E. Dunn Water Reclamation Facility in the sense that this facility is 100% reuse. So all reclaimed water produced at this facility is utilized through our public access reclaimed water system. So today I want to focus your attention to the South Cross Bayou Advanced Water Reclamation Facility with regards to our response to this bill. As I mentioned, all wastewater utilities were required to submit a plan of action to meet these requirements as outlined in the bill, and that plan was due on November 1st of 2021. So the objective of today's presentation is to review and present the conceptual options outlined in this plan to ensure that you understand that each preliminary option that's being explored from a conceptual standpoint. So keep in mind, further feasibility studies will absolutely be required before being able to make a decision to move forward with any of these options. Today we do have 2 speakers on the topic. First is Stephanie Ishii with Hazen and Sawyer. Hazen and Sawyer is the consultant who we worked with to develop this plan, and Stephanie will be presenting these options today. We're also pleased to have with us, as Barry mentioned, Mr. John Truitt, the Deputy Secretary of Regulatory Programs with the Florida Department of Environmental Protection. And after the presentation, Mr. Truitt will speak more broadly regarding the implications and purpose of this new compliance plan across the state. Mr. Truitt will also be able to answer any questions the board has regarding compliance with this new requirement. So with that, I'd first like to introduce Stephanie Ishii with Hazen and Sawyer to present an overview of our compliance plan that we submitted.
Good morning, Commissioners. My name is Stephanie Ishii with Hazen and Sawyer. Very happy to be here with you this morning to discuss the ongoing and forthcoming activities that the county has planned in response to Senate Bill 64. So just to reiterate a little bit of the background, this bill was signed into law last summer of 2021. And the overall intent of the bill is to eliminate non-beneficial surface water discharges from water reclamation facilities to surface waters. Again, that could be a lake, a river, the Gulf, a creek, whatever might be relevant for your site-specific utility. The overall intent is to maximize or extend your potable water supplies by way of maximizing water reuse. This bill required that utilities with a surface water discharge submit a plan for compliance as of November of 2021, which the county has done. And then also included in that bill is required for that plan to actually be implemented for compliance by January 1 of 2032. And so this bill, Florida Senate Bill 64, does recognize that some surface water discharges would be permitted to continue. Again, this bill is specific to the elimination of non-beneficial surface water discharges. So those that have an ecological benefit or those that provide a benefit with respect to public water supply, those would be permitted to continue. There's also some caveats with respect to permitted wet weather discharges and discharges that go to stormwater systems that are subsequently used for irrigation. So overall, this bill is important to Pinellas County because, of course, there are 2 water reclamation facilities that are operated within the county. Again, that's the William E. Dunn Advanced Water Reclamation Facility and the South Cross Bayou Advanced Water Reclamation Facility. As Megan mentioned, importantly, the Dunn facility is already compliant with this bill because effluent is entirely managed via water reuse. And so the focus of today's discussion is really the South Cross Bayou Advanced Water Reclamation Facility because a portion of that effluent is managed via discharge to Joe's Creek, which is a surface water. So if you look at this graph here, what you're seeing is the monthly average of effluent that is discharged to Joe's Creek over the past 5 calendar years. And so you can see on an annual average basis, around 9 million gallons per day, or 9 MGD, is discharged to Joe's Creek from the South Cross Bayou facility. And then importantly, you can see that that discharge amount is variable throughout the year. You can see that that variability is even more clear when we don't just look at the 5-year calendar average, but look at the actual minimum and maximum monthly averages within that past 5 years. So just as an example, within the past 5 years, one of our Augusts had a monthly average discharge to Joe's Creek of around 25 million gallons per day, whereas in May we had less than 1 million gallons per day that was discharged to Joe's Creek. And that difference in the dependence on Joe's Creek becomes even more obvious if we get away from monthly averages and we look at individual days. So this variability in discharge to Joe's Creek can be explained primarily by 2 factors. Those 2 factors being reclaimed water demands and weather conditions. So if we look at this same graph, but add a little bit more information to it, you can see here now that the green portions are still representing that effluent discharge to Joe's Creek, and the purple portions that are added on top are the monthly average reclaimed water use. And so what you can see is that reclaimed water demands are fairly consistent throughout the year. So what that means is that when we've got wet weather conditions, when we have a lot of precipitation, more water coming into the facility, that excess reclaimed water doesn't have a place to go during the wet season, and so therefore we have to rely on Joe's Creek for discharge. It becomes much less of a problem during drier conditions because we have less flow coming into the facility, and people need that reclaimed water for irrigation, so we rely less on Joe's Creek during those times. And so because of that green portion that's shown in the graph here, again, Senate Bill 64 becomes a topic of importance for the county. So with all this in mind, that green portion of the graph basically represents the effluent flow that either needs to be demonstrated to have an ecological benefit associated with it, or requires an alternative effluent management strategy for it in order to be compliant with Senate Bill 64. So with all that in mind, the county has prepared a compliance plan for this bill, which was submitted back in 2021. That compliance plan summarizes existing conditions at the facility in terms of treatment and how effluent is currently managed, and then also explains a roadmap for the activities that the county will be pursuing for compliance with the bill. And generally, those activities are categorized into those 3 categories shown here: continued surface water discharge, increased water reuse, and various aquifer alternatives. And today I'm going to be providing an overview of these various effluent management options, but I did want to note that a handout was also provided with additional information in terms of describing what each of those options are, the anticipated advantages and disadvantages, and then the overall activities that are ongoing with respect to feasibility, costs, and benefits. So we'll start with the first category here, which is continued surface water discharge. And at first that might seem a little surprising, considering the bill is the elimination of surface water discharge. But again, that bill pertains to the elimination of non-beneficial surface water discharges. So this first area of activities that's ongoing with the county is really evaluating whether or not these discharges from the South Cross Bayou facility to Joe's Creek actually do have an ecological benefit. And so the activities that are being done for that are a lot of ambient water quality monitoring, effluent monitoring, to develop a combined hydraulic and water quality model. The outputs of that model will tell us whether or not there is an ecological benefit associated with the discharges, whether or not that ecological benefit can be achieved with the existing rate of discharge, and then importantly, whether or not that benefit can be achieved with existing effluent quality, or if improvements are needed, i.e. treatment improvements to get a different effluent quality. Now, if the outputs of that model show that a reduced discharge is needed or that an entirely eliminated discharge is needed, that's when these other two areas of activities come into play. That first area shown here is increased water reuse, and I'm sure this is an area that you're very familiar with and something that's often discussed with the county. And so within this compliance plan, there are really three kind of pathways of opportunity for increased water reuse. The first pathway is engaging with existing reclaimed water customers, those that have access to the supply but don't use it. So these are our inactive customers. And so what the county is planning to do is really engage and do some outreach with these customers to see what the barriers to adoption of that use might be, and if there's an opportunity for, within existing infrastructure, increasing the extent to which reclaimed water is used throughout the year. The second pathway within that increased water reuse category is looking at these potential new reclaimed water customers that have been identified by the county. And these potential new reclaimed water customers were identified primarily based on three criteria. The first criteria being, what are their historical water demands? So to make sure that if we're going to build any new infrastructure, it's going to customers that actually need that water and will use that water. The second criterion is proximity to existing infrastructure, so that if we're going to build that new infrastructure, we're hopefully not having to build that much. And then the third criterion is really important, and it relates to whether or not these potential new customers are okay with interruptible service. In other words, they can have reclaimed water sometimes, but don't necessarily need it every day of the year. And this is really important if you think back to that bar graph, because we've got seasonal variability in terms of how much reclaimed water is actually available throughout the year. The third pathway within this increased water reuse category is exploring the advanced treatment of the flow coming from the South Cross Bayou facility for use by Tampa Bay Water as an alternative water supply. And so the county wants to collaborate with Tampa Bay Water to see, in terms of treatability, hydraulic evaluations, and overall regional needs, if this supply could serve to be a regional benefit. And so this is very much so coming off of the most recent master water plan that was performed by Tampa Bay Water, which showed that an additional 20 million gallons per day of supply is needed within the next 20 years. And so the results of this evaluation wouldn't be just used to look at the cost benefits of all the effluent management options that are under consideration by the county, but also to look at the various options that are under consideration by Tampa Bay Water to see if this flow might be a benefit, not just in terms of compliance with Senate Bill 64, but with respect to the overall regional supply needs as well. And then this last category, the last category of alternative effluent management options is aquifer alternatives. And so this category really includes three different areas of aquifer alternatives. The first one is aquifer storage and recovery, or ASR. The second one is aquifer recharge without recovery. And then the third one is deep well injection. And so these are very different alternatives in terms of what they mean in terms of practice, but they're categorized together because the studies that are really needed to look at the overall feasibility, location, capacity, and costs of these alternatives are largely the same. But aquifer storage and recovery, or ASR, could provide an opportunity for storing reclaimed water during the wet season so that it could be better leveraged during the dry season. So again, to try and help out with some of that seasonal variability. Aquifer recharge without recovery might have an opportunity to help protect local groundwater supplies from saltwater intrusion. And then lastly, deep well injection. We don't typically think of deep well injection as a reuse opportunity, more as a means of effluent disposal, but it's an opportunity for the county to manage its effluent as needed without the surface water discharge. And so all of these options are being looked at concurrently. There are parallel activities going on right now to really look at, again, the feasibility, the costs, the benefits of each of these options, so that ultimately all of that information can be taken together to really do an informed comparison of how these different options compare and to create an optimal strategy for the entire compliance with Senate Bill 64. And so the need for these concurrent activities is largely driven by the fact that we want to do these comparisons, but also by the deadline that's included in the bill, which is compliance by January 1st of 2032. And so this snapshot here kind of provides a high-level summary of all of those ongoing activities. You can see that starting now, there are already ongoing activities with respect to evaluating the ecological benefits of the continued surface water discharge, activities related to how best to increase water reuse, and then also activities with respect to aquifer alternatives. Most notably, there's a pending desktop study to look at what are those locations of potential aquifer activities, what would the capacity of those aquifer activities be, and then how does that pertain to overall effluent management. Some important milestones shown here in this snapshot. A decision regarding long-term effluent management really needs to be made by the end of 2024 to allow for effective design, permitting, and construction of that long-term effluent management strategy by the January 1, 2032 deadline. And so with that schedule in mind and with all those parallel pathways in mind, there are some immediate next steps that the county is partaking. So those immediate next steps primarily pertain to feasibility studies so that we can do these cost-benefit comparisons. The first one shown there is the feasibility study for continued surface water discharge. It's this combined water quality and hydraulic model. The second one there pertains to increased water reuse, looking at customer outreach, Tampa Bay water coordination, and desktop treatability studies. And then again, the last one there is a desktop hydrogeological study for aquifer alternatives evaluations. And then lastly, I just wanted to note that the county has also submitted a request to the Southwest Florida Water Management District Cooperative Funding Initiative to help support these efforts. The request was for $200,000. That request was reviewed favorably in the Regional Governing Board Committee meeting back in February, and a final decision should be made as of this summer. And so with that, I want to say thank you very much for your attention to this update, and I'd be very happy to address any questions or comments you might have. But before getting to that, I want to introduce Mr. John Truitt from the Florida Department of Environmental Protection to provide a bit more background on the bill itself, pertaining to, from a regulatory perspective, as well as some of the activities that are ongoing by other utilities, and the overall role of reuse within compliance. And so at the end of his presentation, we'd both be happy to discuss questions, particularly for me, probably pertaining more to the county's compliance activities, and for Mr. Truitt, more pertaining to the bill itself. So thank you very much.
Thank you. We'll do right after his presentation.
All right, thank you, Chair, Commissioners. Thank you for having me down. First, I would be remiss if I didn't first mention, I really appreciate your utility folks. The dialogue that they have with our district offices is very beneficial. So we're very happy to have that open communication. So Senate Bill 64, as mentioned, is supposed to stop non-beneficial surface water discharges. When you look at domestic wastewater facilities, that's what it applies to, not industrial wastewater facilities. We have 2,026 permitted domestic wastewater facilities in the state of Florida. 167 are affected by Senate Bill 64. So only 167 actually have non-beneficial surface water discharges. There's also 4 DOD facilities. I was only referring to civilian ones. So when you look at that, and as was mentioned, there's a few ways around it, right? There's, as you saw on the slide, you could go to a stormwater system that's used for irrigation. You could look at aquifer injection, either deep well or ASR. You can figure out an ecological benefit use. I did want to flag on one of the ecological benefit uses. We have seen some where people are looking at hydrating wetlands. There's 2 advantages to that, specifically if you're on the coast. One, obviously hydrating wetlands and making them better is always better, but it also assists with saltwater intrusion when you have the higher waterhead on the surface. Another way you can use that to prevent saltwater intrusion is to actually put in a shallow well near the coast and re-inject there. Now, whether that's going to be determined to be an ecological benefit is going to depend on how robust that plan is that comes in, but I just wanted to do some pilot studies before in the state of Florida about preventing saltwater intrusion by injecting water right at the saline barrier, very shallow near the coastline, which creates a hydrologic head. So even withdrawals inland don't help pull the salt water further in. There are a few exceptions to having to submit a plan. It's usually fiscally constrained counties, but as mentioned, the two utilities you have here both submitted plans. We've already kicked back the approval for the one that is 100% reuse because that was kind of a no-brainer, and I know we're working through the other one. We have till July 1st to tell everyone approve or deny. The bulk of the plans have landed in 3 areas across the state. Increasing reuse and either indirect or direct, and I'm going to get to that type, what I mean by that in just a minute. Hydrating wetlands, we have quite a few that just want to hydrate wetlands in their areas, and UIC. And the UIC, which is an underground injection control program, is either aquifer storage and recovery, so withdrawing it for potable water, or deep well injection. I do want to flag for deep well injection when you're thinking about water quantity in the state of Florida. If it's deep well injected, essentially it's gone. Literally it's not gone. You might be able, it might migrate back up after several centuries. But the idea is that it goes to a boulder zone that's highly saline and brackish. So that water is now out of the loop. And that's kind of not the intent of Senate Bill 64. The intent behind Senate Bill 64 was to ensure that rather than these surface water discharges that may be going to the ocean that we're not using again for potable water, is kept back into the water cycle. So if you look at, I think it was 2 years ago, we were withdrawing on average of fresh water 6 billion gallons a day in the state of Florida. Based on current population growth, we will need an extra 1 billion gallons a day by 2040. So those numbers, right, when you kind of wrap your head around them, are insanely huge numbers. And where is the population growth occurring, right? I mean, I came down from Tallahassee. It's not in my neck of the woods, clearly. It's pretty much mostly Orlando south. There's an interesting hydrologic feature in the state of Florida that's a little north of Orlando. When the rain falls, if it's roughly south of Orlando, it stays mostly in that aquifer area. If it's north of Orlando, our aquifers are kind of separated from you guys. So if you think of a ton of rain falling in where I grew up in Gainesville, that's not really benefiting water withdrawals down here almost at all. And obviously the water management districts take that into account when they do withdrawals. But again, that's the big idea of Senate Bill 64 is let's try and keep all of this water that's going somewhere in a beneficial place. And that kind of gets to the big thing of reuse. Florida is a leader in the country in reuse. As of 3 years ago, we were reusing 40 to 42 gallons per person in the state of Florida. If you did the average number, it's 882 million gallons a day goes through reuse in the state of Florida. And that's out of only 1,625 million gallons a day of treated domestic wastewater. So half of it is getting treated to reuse already. The next closest state, California, and they're at a whopping 16 gallons per person per day. So I know we like to kind of toot our own horn, but when I say we're a leader, by far, we are way ahead of anyone else in the country. And when I mentioned earlier, indirect and direct reuse, those are terms, if you're not familiar with them, I know it's kind of coming more in the lexicon now. So indirect potable reuse is where you're going to take water, inject it into the shallow aquifer, and then at some point in the future, you will be withdrawing that water and treating it for drinking. There's a very important point here that I stress every chance I get to talk, and it's kind of technical, but hopefully it sticks in your head in case you hear something else in the future. The Underground Injection Control Program is a federal program under the Safe Drinking Water Act. So all the wells that go in the ground, it's a federal program that we implement in the state of Florida. If you're injecting into an underground source of drinking water, or a USDW, which is any aquifer that's 10,000 milligrams or less of total dissolved solids, where your pipe enters that aquifer, when the water comes out, it must meet all primary drinking water standards. And I say all because there's 90 of them. There are no variances, there are no waivers, there is no zone of discharge, you don't get a dilution factor. So contrary to some discharges that occur in surface waters, under Section 402 of the Clean Water Act, you can have what's called a mixing zone. So say you have an issue with dissolved oxygen, it's too low for the water body. Your permit can build in a mixing zone, 50 feet, 100 feet, and your point of compliance is 100 feet away from where that water hits. You get the dilution effect. That is not the case with aquifer storage and recovery. There are also secondary standards to water in the aquifer. That's like color, odor, taste. Those are state level standards. Those can receive a waiver from the state. But again, when you're looking at primary standards, which it's all the ones that have direct impacts on health. So think of E. coli, arsenic, benzenes, all of those things, there's no waiver. Whatever the primary drinking water standard is, that's what it has to be when it gets there. So that's important because it is costly, depending on the quality of your water, to meet those standards. And then you kind of beg the question, well, if I'm just treating it to drinking water standards, why don't I just use direct potable reuse, which is literally it comes out of the wastewater treatment plant, gets treated, gets blended into the water distribution system, and comes out taps. So there's obviously a public perception issue with that. I mean, we tackle that all the time. I've heard lots of fun slogans with it, none of which I'll use here. So what we did is we partnered with SwiftMud, the Southwest Florida Water Management District, 2 years ago to do a survey of Floridians' public perceptions. So they grabbed 1,980 people around the state. So the probability charts say that's plus or minus 2.2% variability. And I mean, I'll admit, I'm closing in on 45, born and raised in Florida. When I was a kid, right, nobody ever thought about water in Florida. Water's everywhere in Florida. Why would we need to worry about water? Clearly, it's changed over the years. So what that survey, it was set up so that it was educational. You started out with a blanket question. Do you know what reuse is, right? And you had multiple choice. And then you said, if I told you indirect reuse is when you inject it in the aquifer and withdraw it later, and direct is when it goes straight into the system, do you support or oppose, right? And there was a whole lot of people that came back to the survey that just said, I've got more questions, logically. So the survey walked through, and if it's direct potable reuse, again, it must meet all drinking water standards before it gets blended in with the other finished drinking water. By the end of the survey, it was actually surprising. 65% of the people surveyed supported direct potable reuse, 29% were what I'll call agnostic. They were like, whatever. And only 6% actually opposed it. Now, from all of the conversations I've heard on this, I was actually completely baffled. Not as baffled as I probably should have been, because I'll admit, I drank direct potable reuse for 16 months in Iraq. So that's kind of not a thing to me. We even heard from an engineering firm that came over from Israel, because obviously given their location in the world water scarcity, they calculate a drop of water goes through 7 human beings before being lost. And they've done that for 20 years. So we know the technology exists. I understand it's a perception thing. But the point of the survey was, as the person being questioned got more educated on the safety and efficacy of the process, and that it's not a new technology, this has existed and is in broad spread use, it appears clearly the attitudes change, which is the key, right? It's an education thing. So we have a website. If you Google One Water Florida, you can pull up the actual survey. You can go through all of the other materials we have and the videos on there. And I just put it out there. As a regulator, obviously, I'm an invisible hand in the market, right? I have to enforce the law. That imposes costs on entities. My job, and how I've taken this for the last little over 5 years now in this role, is I want to be the most even invisible hand in the market. I don't have a preference for what comes up in a plan, okay? So if you come up with, I want a deep well inject it and the water's gone forever, that's fine. It is a permittable activity. I want to go to direct potable reuse, that's fine. It's a permittable activity. You know what? I want to just do conservation easements and restore wetlands, that's fine. That's a permittable activity. So I don't want it to be taken away by my discussion of reuse. That was more educational, that the department prefers reuse. We are agnostic in terms of those choices. On the reuse rulemaking, it is important to note, since we don't have formally direct potable reuse in the state of Florida, we obviously had to open up our rules and get working on those. My water division has been, I think they've gone through 127 rule chapters in the last 18 months, updating all kinds of things related to not only this, but the Clean Waterways Act from the prior year. So what we've done is we've currently married up the wastewater rules and the drinking water rules, because previously when they were written, they were kind of siloed, right? You didn't look at them as operating together. It was a little odd. So now they're married up with any conflicting provisions removed, and we're working on adding in the provisions for direct potable reuse. We anticipate we'll have those rules finalized by the end of this year. So that should, any one of the 167 entities that want to go to direct potable reuse, hopefully that doesn't screw up their timeframes given the January 1, 2032 deadline. So that's kind of what I wanted to spit out, and I will also say, obviously I'll take any questions, but if anyone at any time wants to get a hold of me after this because you think of something else, please reach out. I never turn down speaking engagements or the opportunity to talk because that's my job. So I'll happily handle any questions.
Thank you, Mr. Truitt. And I apologize, I missed at the beginning what agency.
So I'm the Deputy Secretary of Regulatory Programs at DEP, so Department of Environmental Protection.
Thank you very much. I know we had a few questions. I don't know if they were for you or for Dr. Ishii. Thank you. Commissioner Long.
Yes, thank you very much for your presentations, both of you. I have a deep interest in this whole subject matter, and especially the comments that were made with regard to when you do deep water well injections. And I'm very curious because I've heard so many stories about, is any of that wastewater from Piney Point being pushed down into the aquifer? Do you know?
So I can answer that. So Manatee County applied for an underground injection control permit and received that last fall. They are now currently working on constructing that injection well. That is a deep injection well, which is going down to the boulder zone. So it's brackish saline water that no one touches. And the way it's done, when you look under, I'm not a geologist, but I'm a recovering lawyer, so I'll play one for a moment. You have confining layers. You're going all the way down. I think that one goes roughly 3,000 feet, if I remember. And then you put monitoring wells above the confining layers to see if there's any upwelling. Of deep wells in the state of Florida, we actually have 16,000 underground injection control wells in the state of Florida. Roughly 3,000 of those are deep. 2 have ever had evidence of upwelling. So it is a very safe process.
So I heard what you just said, but I also heard you say just a few minutes ago that in the future, that could come back up again.
In multiple centuries, in the boulder zone, in multiple centuries, what it's going to eventually do, if it does, is going to migrate out to the coast and come out in the deep marine waters. It's not going to come vertically back up into a drinking water aquifer now. That's where the brackish water is interacting, and that's why it's
No,
there.
I
Yep.
understand what you're saying, but trust me when I tell you it causes me great concerns because everything with regard to what we know today keeps on changing. And I venture to say that 10 years from now, this could be a whole new story. Not that I'll have to worry about it, but I worry about stuff like that. Just my opinion. Thank you.
Thank you, Commissioner. The feasibility studies, when will they be complete?
Okay, am I doing this correct? Is this on? All right, excellent. And so as I showed in the snapshot of the schedule, the long-term decision about the selected strategy should be at the latest done by 2024. And so in order to actually make that decision, the feasibility studies need to be done prior to that. And so the way that the schedule is laid out in the compliance plan is having those feasibility studies completed by the end of 2023, early 2024, so that you have real time to actually take all that information together, look at capacities, costs, benefits, and create a strategy, because more than likely, your selected long-term effluent management strategy isn't going to be solely option A. It'll probably be a nice diversified portfolio of a couple of options to give yourself flexibility under variable reclaimed water demands, under variable weather conditions, variable cost market conditions as you move forward. Diversification could really serve the county, but in order to come up with the right blend, we need all the results of those feasibility studies to consider together.
Okay, that's what I was wondering about the timetable. And then, have you seen in another entity, have you seen a dramatic enough, substantial enough increase in use, either by inactive customers or by new customers, to significantly impact that? I mean, is that have you seen that really work in at least to a portion in some other areas?
So certainly there can be a notable impact on the amount of discharge that's going to surface waters by way of engaging with these inactive customers and bringing on new customers. The big caveat is that regardless, there's that seasonal variability. And so generally to address that, you're looking at substantial storage requirements. Just as an example, the county did have a reclaimed water master plan that was performed as of 2019. And in that study, Senate Bill 64 wasn't yet there. So it was less about completely eliminating the discharge, more about just maximizing reuse. And there was a scenario that was looked at in that master plan about engaging these inactive customers. And they looked at the potential to reduce your discharge by 2 MGD on an annual average basis. So going from 9 to around 6 or 7. And in that scenario, you either needed to help out those customers during the dry season, either needed something else to help augment that supply during the dry season, or needed upwards of 200 million gallons of storage. And so 200 million gallons of storage, just to put that in context, that's about 4 Tropicana fields. So it's a real reservoir, right? It's a pretty significant storage requirement. So not impossible. Pasco County has 2 reclaimed water reservoirs, but you really want to make sure that we're considering hydraulic limitations, storage requirements, interagency requirements when we're looking at increased water reuse.
I think I just found another funding source for stadium, Barry, is what I heard in that conversation. Commissioner Eggers.
Thank you, Mr. Chair. Yeah, interesting. Dr. Ishii, thank you for your presentation, and as well, John, for coming down and being available to us. When you were telling me about that study, I'm just shaking my head because most people that I've talked to, and again, you know, when you talk about education, educating them on how that water gets treated, but there's also a significant cost to that treatment that I, you know, again, trying to factor that through in those kind of surveys and what that means to them personally is something that also has to be taken into account. So most people that I've talked to, and you know, I've been the chair of Tampa Bay Water for the last 2 years, no longer that now, but is that it's a they don't want to necessarily even consider that while there's plenty of other water available. I mean, if there's other water available, why are we even talking about this? So the storage along the coastline, you know, like you're talking about for saltwater intrusion, and then pulling it out elsewhere, like the city or Hillsborough County is talking about doing. Do you consider that direct or indirect? To me, that's indirect, but.
Generally speaking, Commissioner, it would be indirect, but the intent of the injection isn't necessarily for withdrawal of drinking water later. So I wouldn't perfectly slap the indirect label on it. I would view it as an ecological benefit versus an indirect use.
And one of the interesting dilemmas that we're facing at Tampa Bay Water, and I think going forward, is how you value reclaimed water. So some people are just trying to get rid of it. It's like it means nothing. Let's just figure out a way to, you know, we're going to have to treat it more, but we're going to get rid of it at some point until there's a use for it. And then all of a sudden it becomes like oil, you know, like it's like, so we're really having that issue, especially with regards to that project. We're looking at a next water supply project, and that's one that's being considered. And all of a sudden, something that is not very valuable is becoming more and more valuable as it relates to reimbursement. So, but I appreciate your thoughts on it. Dr. Ishii, as it relates to finding other uses for it, I'm intrigued by that one only because we've talked about, well, number one, that extra treatment process that probably has to go through some kind of, what's the process that City of Dunedin uses, reverse osmosis?
Reverse osmosis.
Yeah, so you have to go through that process to get rid of it, or like you said, that it enters in a certain quality
Correct.
of water. But finding companies to use it more often, finding cities that need more reclaimed water. But like you said, we're all going through that same variability during the season, so it really does come down to the storage piece. Practical, not practical? I mean, you talked about 3 Tropicanas. I mean, that's a lot of storage. What do you see?
I think it's practical as part of a strategy. I would be very hard pressed to say that your sole solution would be increased water reuse through non-potable applications without either significant storage in the hundreds of millions of gallons or having substantial augmentation by other supplies. So that during that dry season, so during the wet season, we can really maximize our water reuse customers, get rid of as much as possible, use it for beneficial purposes, but then during the dry season, you bring in some other water supply to help make up that gap. And so I think we don't want to take it off the table. It's certainly in the compliance plan to look at these opportunities for increased water reuse within the non-potable and potable realms. I think we just have to make sure that we're documenting and quantifying those hydraulic and storage implications along the way to really make sure that we're looking at the total life cycle costs and benefits of the various options relative to each other.
And all of those different options are being looked at, including the north and south connections within the county.
So that is certainly an option to look at that, but we don't want to forget that there's other options for the North County
Right.
as well with
I
respect to
understand.
the Tarpon. Yeah.
Have other
Yes.
cities and other, yeah, okay. Thank you.
Yes, of course.
Commissioner Flowers.
Thank you, Mr. Chair. Thank you for your presentation. It was very thorough. I really appreciate it. I find it quite interesting that when Piney Point first occurred and there was the conversation about deep well injecting some of that material, there was a huge uproar. And I know from my previous service on city council in St. Pete, deep well injecting was taboo. You know, we're just not going to do it because there was a concern that it would have issues in the future when it came to the stability of ground based on saturation. So thank you for further explaining how the water trickles down and goes into the boulder structure and is supposed to go straight out. I'm not sure if that's going to be the case since we also have issues with whether or not we are sinking. So, and some of that came up at a conference I just attended that was sponsored or co-sponsored by Commissioner Long. But the toilet to tap, that's what I'm gonna call it. The toilet to tap issue, I think that it was Hillsborough County that either was looking at that or has already kind of put that into its circulation. Is that accurate? Or did you all have anything to do with that or knowledge of that?
City of
So with,
Tampa.
go ahead.
Yeah, I was gonna say, I know they've reached out to us and are very engaged in our rulemaking that is gonna kind of allow that. In terms of a formal application, no, because like I said, the rules don't really exist to have it, but then I don't know from a technical perspective.
And from like the work that's been done, they looked at the treatability from a desktop and pilot evaluations, but it's not in practice at this time.
Okay.
And Hillsborough is not just looking at advanced treatment for potable roofs, they're also looking at the use of these injection wells to help the SHARP program to allow for coastal areas to have injection, help out with saltwater intrusion barrier, protect those existing supplies, allow for a transmission of pressure implications for you to have additional withdrawals over here. But like Mr. Truitt was saying, it's not a direct, you're not actually withdrawing this drop of water. It's a transition of pressures.
I'm glad that you put a perspective on how many Tropicana field water retention facilities would be needed to hold over 1 billion gallons of water. But you would also need to factor in the cost for piping to be able to get that water back out. So it would probably be way more than what we're even talking about topically. And I guess my other question really would be or comment for additional consideration would be for staff. Because there are some people that would like to utilize reclaim, but it's the cost in order to have reclaim piping or lines to come to their home. Typically, and you know this, within, one block, 8 homes, they all chip in, so they're splitting that cost. If one person wants it but the others don't, then they're bearing the full burden of that cost. And so instead of utilizing reclaim, they'll go to wells. I have a well at my house because my neighbors didn't want to help pay for the reclaim. So this is probably for county staff. I don't know if what we charge is, we're just charging for the labor to draw those lines to that neighborhood or community, or if there's a way, if we're going to promote persons to maybe utilize and then educate on the different seasons, because, I've gotten calls before where it's raining, someone's reclaimed water is on. I get calls from neighbors. Why is it that their reclaimed water is on? Well, it's on a timer. And, that's what's going on. Or, of course, complaints from users because they're being asked to limit their use when there's less waterfall and less restrictions. So I don't know if that's something that we could maybe talk about or address. When I say we, I mean the county, a way to maybe make it more financially feasible, and then just do a really good educational program behind that when it comes to our dry seasons. Plus, a lot of residents are going to using drought-resistant type of flora trying to be more conscious of, water and elements and things like that. So,
Yeah, no, thanks for the question, Megan Ross. So to answer your question, practically speaking, it's much easier to implement reclaimed water distribution systems into new neighborhoods, as they're being developed, to go ahead and implement it in, to go back and then, get concurrence or agreement, consensus from the neighborhood that they all wanted, and then to tear up the roads. And keep in mind, reclaimed water infrastructure, we don't have 100% cost recovery on it. So we are supplementing any kind of reclaimed water infrastructure, maintenance, operations, distribution gets paid out of the sewer fund. And the rates we charge for reclaimed water don't 100% recoup the full cost. So it does place an additional burden on the sewer fund to some extent. But then to Stephanie's point that she brought up earlier, it's really about maintaining a level of service. So as you saw from some of the demand charts that we presented, there's times during the year where we have zero excess reclaimed water available, and so customers, particularly residential customers, at a time where there's drought and they need the water, if we are not able to provide that water to them, could just be creating a situation where we're sort of making some promises by building out this system to their homes, and then we don't have the water available to give them. And so we just got to keep that in mind. If we do look at expanding our reclaimed water system, like Stephanie said, looking at those storage alternatives to make sure we can provide the level of service, et cetera. So I think we're still going through all of that. We are looking more towards those interruptible customers like parks, maybe golf courses, where they have an alternative supply available and they can utilize our reclaimed water when we have it available to them. But you're right, it would take a tremendous amount of education to go in and to implement reclaimed water to residential customers where it's not currently available, and those storage options and alternatives built out.
Pasco County does have additional land where they could afford to build such plants, whereas when you look within Pinellas
Yeah.
County, we just really don't have the land to even build one holding facility, let alone the 3 that you're sharing, on guesstimates would be required.
Absolutely.
So, thank you.
Thanks.
Thank you, Commissioner. Commissioner Long.
Good morning again, Megan.
Morning.
And everyone, the other 2 speakers as well. I didn't hear this word mentioned, but I'm curious, especially given the 2-day climate summit some of us attended over the last 2 days. There was almost in every presentation, the subject matter about the heat index came up and how it's changing the way we think with regard to infrastructure issues, and especially as it relates to water and the availability of water. I remember reading articles last summer when those horrific wildfires were burning out west, that it was so incredibly hot that the Hoover Dam showed signs of drying up. And as we know, the Hoover Dam, provides water for all of our country's agricultural crops that are grown throughout the Midwest. And so I'm just curious about whether or not there's anybody within the state government or here looking at how that might affect our supply of good, clean drinking water.
It's a great question. I know we work very closely with Tampa Bay Water, and as you know, they have a pretty significant reservoir in Hillsborough
Right.
County. And they are embarking on various resiliency studies and strategies. I think we recently had a meeting a couple weeks ago about that,
Good.
some of those topics. So we're absolutely focused on that and making sure we address those issues and look towards the future and do proper planning to ensure that we have a sustainable water supply for the future.
Excellent. Thank you.
Very good. Thank you very much to all the presenters.
you.
Appreciate your time and presentation today. We did have a brave food delivery person come through the weather. So commissioners, there is food in the conference room. We're going to take a break for lunch and then come back to our North County item number 4. It is 12:10. What do you need? All right, let's come back at 12:45.
It's in the break room, which is up in the front on the left as you go up. And your ID will badge you in.
Before we get to our next agenda item, County Attorney has a comment.
Yes, we do have an agenda briefing coming up, the last item on the agenda, and prior to COVID, well, once COVID hit, I cut off the practice of sending around the confidential memo for all of you to read. I have resumed that practice, so you will see a memo coming around. It's, I think, with one of our absent commissioners right now, but it will be coming around just as an FYI. It is, again, the memo related to the confidential item that's under the county attorney's portion of the agenda today. Just, again, it's very similar to what we did before COVID, but if you just read that and initial it and send it on its way, and if you have any questions about the case, please feel free to give me a call.
Thank you very much. And also, I forgot to mention this morning, I did get a message that Commissioner Peters had a personal matter arise, and she will not be in attendance today. All right, item number 4, North County Service Center. Mr. Burton.
So this morning, we're going to provide an update on the North County Service Center. So here we have Joe Laurel and Derek Weaver. They're going to provide kind of a history of the project, where we're at, and kind of our plan moving forward. Go ahead, Joe.
I know there's a button to turn this on, but I'm not quite, oh, is it on? I'm sorry. Joe, hi, good afternoon, Joe Laurel from Administrative Services. I'm going to give a real brief update, what Barry said about the prospective North County Service Center. And Derek Weaver, our manager of building and design, will be up here in just a few minutes to go into it in a little more detail. But I also want to acknowledge our clerk of the court, Ken Burke, who's here at the Office Support. And he's been a good partner in this, and he's going to be one of our tenants in the new building. So let me talk a little bit about the current facility. It's about 19,000 square feet. It's located on the west side of US 19, quite a ways north. The building was originally built in 1978, and quite frankly, is too small and has really outlived its useful life. What we're proposing is building a new North County Service Center on the same property, approximately 69,000 square feet, with 122,000 square foot parking garage. And that's going to be needed because of the facility, the way it's laid out, and Derek will go into that in just a few minutes. The actual facility we're proposing to build will not only provide a better customer service experience for our customers, but it'll also save about $800,000 a year in leasing costs that we're currently paying right now for the center on the east side of US 19, about 1.5 miles south of there. So, and that's for the property appraiser primarily and the tax collector. So we're going to consolidate them into the new North County Service Center. The delivery method for this project will be the same delivery method that we worked through for the checkpoint project at the detention center. It's going to be a 2-part approval process. Probably next month, we're coming forward with the first part of the approval process. That'll be to hire the firm to design and program the facility, and then a pricing from the actual construction manager. Then about 10 months to a year after that, we'll come forward with the actual price to build the project. So I want to make that really clear up front too. So with that being said, Derek, did you want to come up and go through the project a little more in detail? And this is based on a concept design too. We hired a firm about 3 years ago to provide a concept, so it may not look exactly like what you're going to see here in a few minutes. Thanks.
Just advance with this.
I know you said it was Wayne North County, but is there a specific address for the site?
Off the top, I don't know if it's in here or not, Derek, I'll be honest with you.
you
The physical
know
address.
Curlew Road.
Yeah.
Off of Curlew Road?
South of Curlew Road on the west side of US 19, by 1/2 mile south.
Thank you.
Looks like 29582 US 19 North. 29582. Okay, all right. Well, again, my name's Derek Weaver, Manager of Building Design Construction. Afternoon, Commissioners. We're excited to present another very nice project to you. As Joe mentioned, this would be a CM at risk project delivery method. We did, what we're going to present to you today is the result of a feasibility study that was done by one of our term architects. So we'll go ahead and go through it. The goal is to replace the North County Service Center As Joe mentioned, it's outlived its useful life. As I said, it was built in 1978. We also reviewed the possibility of adding on to it and renovating it, but it's just not, it's not economically feasible. The structural grid of the existing building doesn't work for an open plan, so it just doesn't make sense. So we really need to build a new facility on this location. And as Joe also mentioned, we need to build a parking garage here because of the size of the site. So we will be building up. It would be a 3-story building and a 2-story parking garage. So again, the goal is to remove occupants from lease space, which is pretty much directly across the street, I believe, the west side of US 19. As again, Joe mentioned, it was about $800,000 a year to lease that space. But what this does is provides a single point of service for North County. That's for the tax collector, property appraiser, and the clerk. And we kind of mentioned these items, so I won't read them verbatim. But again, a 3-story office building with central, obviously circulation and lobby space and so forth. Again, a 2-story parking garage. We'll have some surface parking, but a majority of it will be in the parking garage.
Are the tenants in the existing site east of 19 all will be coming over to the new building in the west of 19, but is there a tenant in the new facility that
Okay.
is not currently in the $800,000?
Okay, so this is all still part of a bigger picture of the courts consolidation project. So half the occupants of what was the North County Service Center are gonna be moved out to the new facilities at the CJC, traffic court and so forth. So only half the building would have to be temporarily relocated while we build this new one.
Yeah, just a quick, on that $800,000 savings in lease cost, that's for the building across the street.
Yes.
That monthly rent that we're paying over there, does that include electricity in all the utilities?
It doesn't.
So you're going to have to back that out of the 800? Okay, so it would be some,
Yeah, I don't know what that number is off the top of my head.
okay,
Yeah.
all right, thank you.
So as part of the new building, we will be reviewing, designing towards, conservation and LEED as well. So we'll implement that into the design. And the consultants provided us a proposal already that includes that. We're reviewing that now, which we're looking to present to you as soon as possible, so.
Not to get into the nitty-gritty of the design, but is that just LEED certified, or are we talking about solar canopy or anything like that?
Right now,
next
we're
level?
just talking about to get the minimum LEED certification, LEED certified. Mhm.
Would that be an opportunity for us to look at the next level of if it costs X dollars more in order to do a solar, carport type thing that you see other parking garages do?
Yeah, they're in a concept phase right now, but they'll bring back elements of that. So those will be part of the design issues that we'll have to discuss through of what makes sense.
Commissioner Seal?
Since we're on this subject, when we talk about LEED certified, it's just meeting the standards. We're
Yeah.
not going through paying for the LEED certification.
That's right.
Thank you.
Commissioner Gerard?
Yeah, I just wanted to, City of Largo just passed something requiring new construction to have electric vehicle hookups. And I'd really like to see us do that,
I think
particularly
that might be part of
particularly in our own
that might be
buildings.
part of a larger master plan
Well,
that Fleet is working
But
on.
no, I mean, that's all
Right.
part of but the greening of the fleet, that's exactly right. When you build a new building, we're gonna plan for that. And so that needs to be incorporated as part of this. And
But also
But
for,
they're
not
doing
only
it
for
not
our
just
fleet,
in
but for
theirs, but-
customers.
for customers as
Yeah,
well. Yeah, so absolutely, that needs to be part of this planning process.
Just, this is unrelated, but just to, I want to look at that on a general level. If we're looking at multifamily things or office buildings, whatever, they're requiring private entities to do that as part of their new construction.
I thought there was a preemption on us, local governments requiring charging stations at don't know where I heard, somewhere in the last 2 days, I think at a conference I was at, I heard something along those lines, but I might be mistaken. Next, we want to get into the color of the building. We want to talk about paint colors.
I think
Light blue.
we've got a lot of words and things up here. I think when Derek gets into kind of the concept plan, it'll give you a better idea about what we're talking about. And Derek, I really want you to hit on why that need, what's in there now, what the space is, where you're going with that, so.
Okay, yeah, we'll get to some Axon and site plans, and you'll be able to see what's existing on the site, and then where the new construction will be, so. We kind of summarized this slide already, who's in the building, the square footage of it, and the size of the parking garage, so.
I'm sorry, one more. We have, do you have a question from Commissioner Long?
Yep.
Oh, I do, because I'm paying very close attention to what you say versus what's written on the documents up there. And it troubles me greatly that you mentioned we're doing the minimum that we need to do in order to meet the LEED certification. Why would we be so proud of doing the minimum?
Well, that's LEED certified.
Right, I get it.
We can review options for silver, gold, and platinum, but at each level, there's an added cost to it, but we can certainly review it.
There's also an added savings, and I'd like to
Sure.
focus on that as well.
Yeah, we can obviously
So
review that with the architect.
I mean, let me help staff. When we're looking at buildings like that, we do need to look at this, and we need to look at whether the certification or not, because I've done buildings without the certification, but incorporate all the standards. But it's also very true that in today's environment, I'd like to know what it costs to do the certification, because it's went down dramatically from what it was even 5 years ago. But I can't tell you that today because we haven't got to design elements. So we'll make sure that we bring those choices and those discussions back to you when we actually get into design, because we've only done a concept at this point.
Right, and I just have one more thing I want to point out for the benefit of folks who were not at our two-day summit that just got over yesterday. We are not making decisions here for today. We're making them for the future and for future generations. And so I hope we will keep that in mind and not get stuck on the information that we've learned from the past things that we've done when we've been building new buildings.
That's a good
Thank
point.
you.
Mhm. Yes, thank you.
Not to argue the point, but several years ago, when we first started embarking on this whole LEED certified, I said, I think it's great to meet the standards, but we don't need to pay for the certification. If we know what it is, then we just go ahead and incorporate it in the building. So I agree, we should be looking at the highest ability to get payback for our money and for the future. But I still can, why do we need a little plaque that says this is a LEED certified building when we can build it to that standard?
Well, I have an answer to that, if I may. If it involves us pulling down federal dollars, to me, it would be worth it. And hopefully, and by the way, it's not argumentative to disagree, as long as you're not disagreeable. I'm okay with that. But I would like to know what the cost is before we just automatically say we don't want to do it.
Well, we haven't said that, and we're going to bring back some of these choices for you, because these are important issues and they've changed over time. And so, but let us get to the design, and when we come in with design elements and we discuss that, we'll also incorporate choices on where we're going with sustainability, and we can discuss that at that time.
And while we're on this slide, because you guys haven't got to the last slide to get sticker shock, but, I really want a parking garage defensible, because if there's a bill, we need to know that they really need 356 spots, because parking garages are very expensive.
Yes, they are.
And if there's any other option, I'd much rather see that we could explore that.
Yeah.
So, and I don't disagree with you. If we can get federal funding, of course, we should always go after that. But I just know that we can build to a certain standard if we wish to.
We'll get to the site plan where you can see the constraints of the site where we need to build the parking garage.
I'm very familiar with the site.
Okay.
Yeah, the 356 spaces are from a 3-year-old study, so because of some of the ways we're operating these days, that might actually shrink. We go through the programming process, we will determine that, Commissioner, yeah.
So basically what the project entails is demolition of the existing facility obviously new landscaping, pavement for parking, retention. There is a pedestrian overpass planned to go over US 19 right at that location, so we've planned for that as well. And then obviously the lead design. And right now, we're estimating the cost to be about 34.5. So.
That's also going to be the program. Public transportation.
Public. Yeah, I'm not exactly sure where the stops are, but yes, yes.
Microphone, please.
That's okay. I can
Thank you,
hear.
sir.
Yeah.
I know that they've already talked about charging stations, but just sharing, I know when we've had conversations with Brad Miller with PSTA, we've talked about how we can partner with other entities for those charging stations. Since we have buses that are out, it would be less expensive for them to have to come all the way back to PSTA's park to recharge. So any partnering we could do in those areas would be absolutely wonderful. And that doesn't just speak of our buses, but we also have the vehicles that pick up persons who are disabled and whatnot, so.
That's a very valid point, Commissioner. In fact, that's part of our overall EV plan. We're going to look and see if we can partner with other agencies, even Duke Energy, for instance, among others, to see what we can do to try to get economy of scale from the charging perspective. So, yeah, it's got to be part of the overall plan.
Thank you.
Sure. So you can see the existing site here, where the existing building is and the storage building. So that's the east side of the site. The back half, the west side, is the existing tax collector driving range and the solid waste recovery facility. So those will remain in place. So we're limited to the front half of the site for development and construction, so. And you can see a site plan here. On the right is the pedestrian overpass that comes over US 19, right in front of our building. So the parking is based on the size of the building occupants. The square foot of the building determines how many people and how many parking spaces are gonna be required. So with the constraints of the site, we need to build up a 2-level parking garage. We did review a 3-level as well, but it was a better plan to use the 2-level parking garage.
You need all that surface parking plus a 2-level garage?
Yeah, the surface parking is limited. I believe it's like 28 parking spaces in front of the building, which most are handicapped.
But around the parking garage, how many is that?
The total parking spaces?
Well, yeah.
356.
That would have to suffice for public.
So 356 total, how much surface, how much in the garage?
There's 28 surface
Okay.
in front of the building, right in front of the
So
building.
that picture is not scoped to size there. The white spot is not just the size of the garage compared to the other spaces.
And he said the majority of those ground are handicap parking.
Well, a
spaces.
lot,
Oh, sure.
you can see, you can count 1, 2, 3, 4, 5, 6. I mean, this is all conceptual right now. So we still need to go through the full design. And again, we need to go through a programming phase, again with the architect, to determine the actual square footage required. So this could reduce the number of parking spaces. So,
That works out to like 5 parking places per 1,000, which is not extraordinary. I mean, it used to be 4 was a standard, now it's 5 or 6. You see that very commonly. I don't know exactly how the operation's going to look in this building, but 5 parking places per 1,000 is very reasonable.
Having utilized the tax collector's facility several times over the years on the east side of the street, that parking garage is probably pretty accurate. I mean, that parking lot's packed. You can't find a place to park, so that's one of the reasons why there's 356 spaces in that garage. The tax collector has a lot of customers who are going to use this facility going forward.
yeah. And there's just one more view of the full site with the proposed building. Again, this is very conceptual, so we'll be coming to you soon to move forward to get approval to move forward with the design and to bring on a construction manager, so.
Talk about kind of the history. How did you come to this? You had this in the original Penny back when you were programming this back. Tell us about the history and how we got to today, because there's a lot that's changed.
Sure. Well, one of the first things, Barry, I wanted to point out is that that whole gray area is the parking garage, not that little white
Oh, yeah.
area right there. This project was part of the Penny, the last Penny, and it carried forward. There's, like I said, the building we're using right now is way undersized. There's issues. We constantly have to repair things up there, and this was programmed in about 6-7 years ago from the prior Penny to build this facility. It's been something that's been long coming, to be honest with you. And moving forward at this time, from a timing perspective, with construction and everything, you know, we'll judge that when we price it, but we're hoping that when we do get a price about a year from now on this, it'll come down significantly from what we're estimating. And of course, you know, we can build in some creative engineering too going forward to see what we can do from a, like Commissioner Long said, from a solarization of the facility to whatever, to potentially save money too. We'll factor all that into the overall design. But this project has been in the works for about 7 years now.
Commissioner Eggers had a question, and then
Yeah.
Clerk Burke.
And then, so we have a new design on 19 coming, right? I think about the folks that either are living up north, working up north, and they leave the complex. There's going to be some underpasses, I'm assuming, I think that's right down the road. So there'll be opportunities where that it'll take a mile or so to get all the way over, do your U-turn, and you'll be on frontage roads, right? Is that, so
Yeah,
we're going to be
that's
on a frontage road?
Right.
Okay.
Exactly, yeah.
So that'll help as far as all the
Getting
night.
on and off US
But
19, yes.
it actually constrained our site because we lost some of our frontage because of the DOT frontage roads and stuff.
So you'll be able to get out onto the frontage road and then do a U-turn underneath 19 to go north? Okay.
Right, exactly.
Thank you.
Mr. Clerk.
We talked about the building, but I want to talk about the bigger purpose here, and this is to serve our citizens so much better. If you think about it right now, this building was built with the primary purpose of having a traffic court and clerk's office in it, and we had times I've had the supervisor and the tax collector in there with a small segment of it, but their big operations are across the street. And it's very confusing for citizens coming to visit because if they come to the clerk's office, let's say they have traffic citations they need to pay to reinstate their driver's license, they come and see us at the clerk's office to to pay their traffic citations, then we have to send them across US 19, and as Commissioner Eggers just pointed out, there's no good way at that point to cross US 19 to go to the tax collector's office to then get your driver's license reinstated. People often go to the property appraiser's office to drop off their value adjustment board petition because they think, oh, this has to do with the property appraiser. And the property appraiser says, no, you have to go across the street, US 19, at one of the worst spots there, south of Curlew Road, to drop off your value adjustment board petition. There's this constant synergy between these two offices as far as our functioning and sending a person from one to the other. For us to be all in this service center together, which years ago we visioned the great need to have this so that we can say, you want to go visit Pinellas County government to get your business taken care of, here's the place to do it. Here are the various services offered there, and we're not going to ask you to go across US 19. We're not going to ask you to go to a different building. We're all going to be there jointly together to make the services a lot more available for us citizens. So whether the building's a top lead building or a minimum lead building or whatever else, the services to our taxpayers will be tremendously benefited by us having us all under the same roof. Also, the ideas too, which is done, and I went down to see the model on 34th Street where the tax collector and the property appraiser, where you don't, not everyone has their own seminar room. You have one seminar room in the building, which we would all jointly use. There's joint usage of break rooms and other common facilities there. So it just makes a lot of sense from a lot of different directions. But I think the biggest winner in this is, again, the citizens in North County being able to stop at one stop for a lot of the services that we offer from the constitutional officers. And I thank you for your consideration of this.
Thank you, Mr. Clerk. The overpass, the walkover, that's a walkover, not a
It's a pedestrian, yeah.
pedestrian overpass.
Yeah.
I mean, it's great, but, I mean, who uses that? I mean, okay. All right. Commissioner Seaton?
Well, I guess I was puzzled because I don't remember that being part of the Forward Pinellas.
It is.
It is?
Yeah. Yeah, down at the north end, they had that, and then as you go further south, they had some underpass.
Yeah, I remember the underpasses, I just didn't remember
Yeah,
an
this one is
overpass.
up around, this was around Bob Evans area, the old Bob Evans restaurant. Yeah, they were gonna have the one walkover there, and then the other ones down south were gonna be walk-unders. So, yeah.
Commissioner Flowers?
Thank you, Mr. Chair. Two things, one, I guess, selfish, and the other for public. It would be nice if it was a little room in there where county commissioners, if they have meetings up in that area, they could meet with persons from the community. Anyway, I just thought I'd throw that in there. I will say that the joint usage facility in St. Pete works really well. When I've had to go in there to get my tag renewed or whatever, the process was very smooth. The receptionist right there at the front. And you're directed to go to whichever side you need for your business. So it does work really well. And if you have to do business for both, it's all in the same place. So I have to certainly concur with Mr. Clerk on that. Oh, my Lord. So having said that, I just forgot my second point.
It's okay. Part of the 69,000 square feet will include some rooms that could be utilized
Shared
by.
spaces.
Yeah, by shared spaces, so the commissioners could use those rooms.
Oh, yeah, that was
Absolutely.
that was a shameless plug request, but that wasn't my other question.
And a good model for this, as you pointed out, Commissioner, is the South County Service Center that was built
Mm-hmm.
about 2 years ago, give or take. That's a good model to go from a workflow perspective and everything.
And it does
Design.
work really well. And I completely concur and agree with all that Commissioner Seal has said when it comes to the cost for garages, especially when you're looking at the cost of pouring concrete right about now, or even laying the rebar for the form to pour the concrete. So the cost will probably be way more, because of that. But I can also say, and this isn't what I wanted to say, I forgot that still, but when I've gone by the place on 34th Street, that parking lot, I mean, people even go over to the Goodwill, where they probably shouldn't be doing it, but they even go over and park at the Goodwill. So that brought me to the point that I wanted to ask. During COVID, because of COVID, they requested that you make an appointment. But then there were times when even with persons that made appointments, it was a line for people, waiting. The security guard did a wonderful job at keeping people, moving as best they could. I don't know if there would be any consideration for some type of awning or covering. Should something like that ever have to happen again, that would protect people from the elements, whether it's raining or what have you, because again, very good process, persons were in line, but there were times when it was a long
Yeah,
line.
and that was discussed on the South County Service Center as well, to provide enough cover, and then even just the vestibule entry before they open the secondary doors, that people could wait. So, yeah, we'll review that in design.
Okay, that was my
And
comment question.
Commissioner Flowers, on that too, is that that's only used by 2 entities. This is going to be used by 3 entities.
So, yeah, you.
And so you're right about the security there, but that really only affected the tax collector's operation. So if you said you were there for the property appraiser, you bypassed that and went upstairs to see the property appraiser. But that's something we pointed out, if there's going to be a backup in one of the entities, this has to be designed differently than what we have on 34th Street. And also, I do want to point out that this building, just to give you perspective, if you go by the current building, this building is going to be a lot closer to the road than our current building. Just to give you, because when I first saw this and they were explaining it to me, I was thinking, oh, they're replacing the building. They're not. The building's going to be way more forward, closer to US 19 under this design than where the current building. There's a lot more green area before you get to our building.
Yeah,
Thank you. That was my question.
okay,
Okay.
all right. Thank you. Any other questions, sir?
Commissioner Eggers?
Yeah, that $34 million that you guys are estimating, that's for the building, the garage,
Yeah.
demolition, FF&E or no? Just,
No.
no, just the building itself?
Some FF&E, not,
Oh,
not
built-in, yeah,
desks and
but-
things like that, but the stationary things, yes.
Barry, do we ever look at that little drive course for, just, going back to number 1 on the agenda, lessons learned for vaccines and stuff like that up there? Was it too small or?
Well, the biggest issue, we're trying to look for covered spots. One of the biggest issues when we were trying to find locations is half the time it was during a hurricane season. And so, trying to put up tents, cover from the elements and things like that. So we were trying to find, buildings to be able to go into. That's what made Lake Mahaffey so nice, is because you were in a parking garage, and you could put up fans and keep people comfortable and stuff like that. Out with tents and stuff, it was very, very difficult, depending upon the season you were in. But they did look at several different locations, but again, then I've got to get the tax collector to shut down his driving track, and, then that becomes a problem.
You just have to fight with the tax collector. All right, thank you.
Yeah.
Thank you.
Thank you, Mr. Loro. Thank you, Mr. Weaver. We appreciate it. Caught us after lunch. We were fired up, ready to go. All right. Item number 5, Health Equity Resolution. Commissioner Flowers.
Hello, thank you all so very much, and thank you, Mr. Chair, for allowing me to place this on the workshop agenda. If you all recall, I sent this out a little while ago, just asking if you would please go ahead and review it. This resolution is as a result of a meeting that I had with Mr. Carl Lavender and some other members of the community. Their request was a resolution much different from this one. They wanted a resolution that really mirrored what had been passed in the city of St. Petersburg. But as I explained to Mr. Lavender and his guests, we've not had a disparity study. We've not talked about certain things, and I thought it would not be appropriate to introduce a resolution for things that we don't yet have any backup for. But I did think that it was appropriate to address something along the realm of health. Thank you to the county administrator, Mr. Barry Burton, and to legal for reviewing it and making some appropriate changes and taking into account some of the things that I was asking. And so the document that I provided to you all, hopefully you've had a chance to review it and make any comment, and certainly provide your comments today. But I would hope that I would gain your support in passing this. We have talked about health and health disparities and things of that nature. We certainly are moving, I think, in the right direction when it comes to behavioral health. Our CAM certainly is evidence of that. And then certainly talking about the number of persons who may overdose on a number of illicit drugs and whatnot, and what we can and or will do along with the sheriff's office and so many other nonprofits to try to help with that. I think we've also moved forward and done a wonderful job addressing some of the food deserts in our communities throughout Pinellas County, and working to assure that accessibility is available for all families. Everybody can fall on hard times at some point, and you just need that extra help. So I think that a resolution addressing health, or stating our position as it relates to health disparities and what we have done and what we're willing to do and commit, would be appropriate. So, Mr. Chair, I present to you the resolution that, again, I sent out in advance. And at this time, certainly am open to questions, comments, concerns, desires, or requests to add, delete language, or whatever would be the request of the body. And then again, I would like for us to have this on the agenda for our next meeting for an actual vote, since we can't vote today.
Thank you,
Thank you,
Commissioner.
Mr. Chair.
County Attorney, can you just explain the binding requirements that we're placing on the county by passing this very well-written resolution?
This really is something that's more aspirational, that's stating your intention to hold to these principles and the policies that you develop. So again, with many of the resolutions that you adopt, this really is an aspirational document that would say it's our goal and our intent to recognize these policies and address them in other initiatives that the county may bring forward.
Very good, thank you. Further questions? Commissioner Gerard? Commissioner Long?
Yes, and I'm curious, thank you, Commissioner Flowers, for bringing that forward. That said, I would like to know, before we make decisions on this, from our Health and Human Services Department, maybe Lourdes, I don't know, or Karen, to make a little presentation or something to us to let us know what we already have done that is maybe pertinent to this subject matter.
Well, Lourdes can come up. She can help me with this. So when Commissioner Flowers, brought this forward, obviously we're very involved in healthcare and addressing areas of our community that are underserved. And so we tried to work with crafting a resolution that would kind of fit those areas. It's supportive of ongoing efforts to close disparities, make sure we have access to care for everyone. That goes into all the programs you have. You currently have a program that addresses health, okay? You have voucher program, but I'll let Lourdes hit on all the different programs we have, but it's very in tune with the service delivery that we currently provide.
Sure, Lourdes Benedict, Assistant County Administrator. So actually, Dr. Joshua Barnett from our office in Human Services actually is the one who wrote this in conjunction with Karen and myself and the Department of Health, as well as the Health Equity, Health and All Policies person that used to work here, Caitlin. So it all looked at all the programs that we already do have with Human Services. For example, all of our housing programs, all of our AFAP program that we do with 211. We look at all of the data when we contract with someone as far as equity. Who are we serving? What does the community look like? Are we hitting the marks with that? That's basically what we do constantly when we do anything, in working with like Dr. Cho. Karen and that team meet with him at least monthly to look at all of that. So there's everything that we do, behavioral health, all the programs that we have, this is what we look at.
Commissioner Gerard?
Yeah, and I see this as just the next step. We, years and years ago, we did the pockets of poverty thing, and then the health and all policies, which isn't just about human services or health, but it's in about design and codes and all kinds of things. And even in our strategic plan, that we're going to direct resources to the areas of greatest need. I just think it's one more way to establish this in our minds. So I'm in favor.
Commissioner Eggers?
I keep forgetting to turn it on, and then I forget to turn it off. I'll get it in a few more months, probably. Turn it off. Okay, reading the resolution, I agree. I thought it was really well written, well done. And so when I get down, I'm reading in the main body of the resolution when it talks about prioritizing social equity, because see, to me, again, I don't live the world necessarily day to day, but to me, supporting, prioritizing social equity of all people, it was persons of color, persons with disability. I'm wondering when we isolate persons of color, I'm assuming that's African American, Latin American, Asian American, any race. And then I was thinking about like our senior citizens that oftentimes have difficulty accessing healthcare, and whether they shouldn't be either, whether you don't put any in there or you add that category to this resolution. I think it starts to at least identify, instead of just the and others, maybe we could think a little bit more about what the and others are. So if you want to keep the persons of color, persons with disability, and then maybe adding what other categories that you think are pertinent or relevant in terms of numbers, because there's a lot of numbers of people that are in that poverty zone, regardless of that. So your thoughts on that?
And actually, thank you for bringing that up, because that's one that I was thinking but missed it when Commissioner Long asked about the programs. You know, we have our age-friendly that we still do. Actually, Karen just facilitated a meeting with all the directors just in the last couple weeks. So we're going to be bringing that plan, and all of that does also, it's everything we do is just woven into this.
And then what Commissioner Long said about maybe refreshing us on things that we have done or have accomplished. And then maybe, because again, I don't work in the social services world on a day-to-day basis, but maybe there are other things that, that are in that aspirational thoughts that still need to be addressed. So we have a list of things that we're working on and doing well. And then maybe there's, at the same time, other things that, we're having an aspirational resolution put together for something, which means we're not there yet. So
Right.
maybe we could have a summary of what we've done and what we still think needs to be done.
And one that comes to mind right away, Karen and I just met with an organization recently, is food insecurity. Although we did a lot during COVID with CARES, I think there's still work to be done there. So again, that's a big piece of this that I think we could do better.
Yeah, I
than we're
remember
even doing.
starting up, like Dunedin Cares in Dunedin, and, there's Feast in Palm Harbor, and people said, well, we don't have those issues here. And I said, oh, yeah, we do. Just watch. And the numbers of people that go there for assistance and help is just mind-boggling. So, yeah, you're right. It goes from Tarpon Springs all the way down to the southern tip of the county. So, yeah, I think that's a great point. Thank you.
And Mr. Chair, I don't have a problem with adding that word if you want to, which is in the now therefore clause. I think that's where you're talking about.
Yes, it's
Where
in
it says persons with disability and elderly, or however you want to add that language.
Yeah.
I don't have a problem with it. It just further delineates who you're talking about and addressing a group. So I don't have a problem with that.
Commissioner Long.
Yes, and I'm glad to hear Commissioner Flowers bring up the word elderly, because I remember after my first strategic planning meeting, after I was first elected to the county commission, we spent all day going through everything we do and what we needed to do. And the one group of folks that we never spoke about was how to encourage our county to be a little more age-friendly as people aged, and how could we better keep them in their homes and still make sure they had access to the things they needed to do, like the doctors and groceries and, just going out and meeting with friends. And so we started that, and I know we got the designation as a purple county, I do believe.
An
But then-
age-friendly county,
Is
yeah.
that what it's called? Well, anyways, I don't really hear anything too much about what we're doing in that regard. So as somebody said, I don't know, David or Pat, it'd be nice to get a little update on all of the above.
And we already have a plan for that. Like I said, Karen facilitated that meeting with the directors. Our new plan is coming up, so
Right.
we want to share that with you, obviously. That was just about 2 weeks ago, so all of the departments now are working on their updates and all the lessons they learned from COVID as far as age-friendly. So all of that is being rolled up to provide an updated plan.
Nice.
So that's something we'll be bringing back to you.
Great, thank you.
Further questions? Madam Attorney, what do we need to do as far as process to get this on our agenda?
I think it's really how you choose to handle it. You could very easily add this under County Commission new business for your upcoming meeting on Tuesday.
All right.
We'll revise the resolution and send it back out as you propose, and then give it to Commissioner Flowers to bring up at your meeting.
Very good. All right, next item is the item number 6, tax collector's request for gov domain. On Granicus, you'll see an attachment letter from our tax collector. Basically, they want to go from a .com to a .gov, and there is a requirement for the local elected body to approve that. So, but I wanted to bring that to the commission, see if there's any major objections. Otherwise, we'll move forward with making that communication. Okay.
Is there any negative reason why we wouldn't do it?
Not to my knowledge. This is happening around the country. From the beginning of websites, people did the .com. What the tax collector explained to me was that there was more of a public comfort level with a .gov when they're making their payments. Okay, we'll move forward with that. Item number 7, agenda briefing. Mr. Burton.
All right, here we go. So you have several presentations, Water Conservation Month, National Community Development Week Proclamation, Child Abuse Prevention and Volunteer Appreciation Proclamation, and Employee Recognition Awards. Going on down, we have consent items, items from the clerks, vouchers, items received, reports received for filing, and miscellaneous items received for filing. Any questions on any of those? Item number 14, which is a cooperative funding agreement with Southwest Florida Water Management District. This is for improvements at Starkey M10 Stormwater Facility. Provides $324,000 in SWIFMA funding. Item number 15 is a joint funding agreement with U.S. Geological Survey, Department of Interior. This is a joint funding agreement for, let me see here, constructing and installed data gathering stations at various locations. This will give us access to that data. County will contribute $198,000 towards this, and the USGS will provide $71,000. Item 16 is a ranking of firms and agreements with the top 5 ranked firms for land surveying and mapping, and they're listed in your packet, so they can use any of them. They've got a cap on the amount of each one in total. Item 17 is award of a bid to EVCO, whatever, Water Technologies for odor control unit prevention and maintenance and repair. And this is at the South Cross Bayou Reclamation Facility, $1.3 million over 60 months. Item number 18 is award of a bid to Thatcher Chemical for aluminum sulfate liquid at Tampa Bay. Oh, it's under a Tampa Bay cooperative contract. Obviously, this is for a 5-year cooperative contract and used by a variety of departments. It's again through a cooperative, so there's other cities that are listed that also participate in this. Onto the regular agenda, item number 19 is the second amendment to the capital project funding agreement. This is with the CVB for the Florida Holocaust Museum, and this is an extension of the project and including a waiver for the capital program funding guidelines. Request is for $350,000. This is what's it? Sorry.
It's just a timeline extension,
Timeline extension.
not a financial change.
Correct. Item number 20 is the Community Services Association Palm Harbor Parks and Recreation. This is for an MSTU related to construction of concrete bins and storage of their material that they store out there, $17,000. Next is an MSTU special project. This one replaces the existing flooring in the Youth Services Department. And this is over at the Palm Harbor Library, $20,000. Item number 22 is 3 applications for funding under the Penny for Pinellas Sites program. So they're listed below, and so we'll have a brief presentation on those for the employment sites. Just as a side note, so these are 3 that are currently processed and recommended for approval. We opened up a new round and there were 11 applications. And so actually program's beginning to take hold and we're getting some really nice response from that.
Commissioner Seal.
I've only briefly had an opportunity to review these, but I see that the criteria score for the Orange Station is very high. But wasn't this is the former police station in St. Petersburg, wasn't this bid out and chosen by the city of St. Petersburg for this developer?
Teresa's coming up.
Hi.
Hi.
Yes. Yes, this was the former police station. And on the section, there's the attachment pages that talk about each of the projects on your agenda. On the back end of that one, it actually breaks out how much the city of St. Petersburg has committed as well. to this project. They've contributed demolition costs, they're helping to offset, there's an affordable housing component, so they're providing a lending component with that. And then the final piece is that they're contributing to, involves the a parking garage that is being constructed. They're making sure that somewhere in the neighborhood of 400 spaces, they're underwriting 400 spaces in that parking lot to be able to be accessed by anyone in the city or anyone that comes and uses the facilities at any given time. This specifically, the request that's in front of us is only geared towards the office component. That's all it's addressing. The total project is somewhere in the neighborhood of over $80 million. But the 50,000 square foot Class A office component is approximately $16.3 million alone as a standalone.
Okay, I see the project sheet, but I see the project sheet, but I don't see the dollar specificity. It only shows the front, only one page.
You don't have the second, it doesn't have the second page? I apologize, I can.
Let me
yeah,
just
'cause
double check.
there's a-
Okay, I see the, oh, I see, okay.
Okay.
The only, I mean, because this is in, okay, it doesn't receive TIF funding, but I don't know, I have some concerns about this because it's, the vacancy rate in downtown St. Pete is 5%. I mean, we really were trying to do this to incentivize brownfields and scrapeable land and other places where, you know, and it says workforce housing, where, how, if we need, I would like more information about, is it workforce or is it affordable housing? It might make a big difference in my opinion.
So again, we've kept ourselves separate from this particular piece of this. We are only focused on the office component. So I do apologize because they've not come to the county to request funds for the affordable housing. Only the city of St. Petersburg has received that request for those units. So I don't have any information in regards to this. I will tell you that this is the first Class A speculative building that's been built in downtown St. Petersburg in 25 years. So we're looking at our vacancy rates in the core area are actually under 5% at this point in time, and there is a great need. There, you know, the majority of office space that is leased today in Pinellas County, when we look at it across the board, not just in our downtowns, is all medical use. And this is the first opportunity where we actually get to look at operations that could be used for target industries. And it's really a key element for the growth of what we're trying to do in economic development.
Is the developer paying the city of St. Petersburg any monies for the land?
Yes, ma'am.
How much?
They did pay for the purchase of the property. I can come back, I can get those clarifications. As a matter of fact, the developer, the head of the development team was here earlier today, but when we realized that it was gonna go on long, he left, but he will be at our meeting on Tuesday. So I will make sure that, to make him available for any other comments. But in the meantime, I will gather the information in regards to what you're asking about. How much did they pay and what were the commitments? But it was an extensive commitment that they've done. They just went on the market with their, they've got condos that they're also selling, so that just went on the market. They're completing their demolition now, but that's the only things that I truly understand when we're not talking about the office. I focus on, you know, what are the 50,000. So I apologize.
And I understand that,
Yeah.
but there is, when you're looking at something this complex, you
Mhm.
need to, I don't really want to underwrite somebody's profit, and if they're going to make profit from other areas, then I don't know. I just have some real strong reservations about, you know, because again, it's a whole complex, so.
Sure.
It was 6.4 million that the city received.
For the land?
For the land.
Thank you.
Wow.
Thank
Okay.
you.
Okay, well, we'll wait for Tuesday, but.
And
And
I
I would
can-
like, if you've got more information, the more information I have, that would be probably helpful.
I will have the developer provide me with some more information so we can get it to you in the meantime. But I would like to say to you that, please, if this gets a conditional approval, we go through a significant due diligence process to be able to verify that they're not making large sums of money on the return on investment. It's part of our program. It's part of how, this is a critical element. And we've talked about how this is such a critical component. So, and I think that the process that we went through during first phase round was very efficient. It really did.
If this wasn't a hot market, and if they didn't have a 5% vacancy rate, and again, if it's the whole deal, it's not just this piece, you got to consider the whole. Thank
Here's some
you.
additional information for you. This actually came to us before, and we, no, it didn't. No, that was a different one. But the difference on this being the Class A, and that's the #1 priority for, St. Pete in terms of trying to attract that into the downtown area. I understand your questions, but it's a low vacancy, but nobody else is building it.
No.
So even though there's a low vacancy, they're not building Class A office.
I understand that, but this was a bid out process and this developer was picked. So to me, that's a competitive process that then you just turn around and don't go give me some money. So.
And they're receiving $8 million from a TIF for the parking garage and a $2 million workforce housing loan from the city as well. Commissioner Eggers.
Yeah, I think Commissioner Seal is touching on most of my concerns too. You said it was $16 million building?
Yes, sir.
And so-
16.3. 16.3 is the office component piece.
Right, and we're talking about 3 million. So you're talking, what is that, almost 20% of the cost of the building itself. I don't know, when they say they paid $6 million for the land, I don't know if that's good, bad, or anything in between. So I don't know the size of the land, I don't know what the market rates are for land downtown, and if they're getting a great deal on that, or if they're getting they're overpaying for it, or I just think for $16 million, $3 million is an awful lot of money for a project. So just some concerns that I have as well. So, thank you.
Further questions? Very good.
Item 23 is an award of bid. This is for the North Highland Road and Drainage Improvement Project. Questions? Item 24 is a change order number 1. This is for 131st Street at 82nd Avenue. This change order for additional construction services beyond the original scope. So this was a older project. They brought it back out. There were some changes that they wanted to incorporate within that design because it was previously scoped, but there wasn't funding available in past years. And so they're bringing this forward, and this change order would accommodate closing up a sidewalk gap and doing some additional drainage work. Item 25, change order number 1 with Preferred Materials. This is our countywide resurfacing, restoration and rehabilitation paving contract. This contract increases the contract amount by $400,000 for the term, and that's just to accommodate additional work that they want to include within that. Item number 26 is the Florida Shared Motorized Non-Motorized Trail Network Agreement. This is for, actually, I don't remember this one, so sorry. I'm reading as I go along. Kelly, or I'll have Joe come up because I don't really remember this one.
Good afternoon, Jill Silverboard, Deputy County Administrator. This is the section of the South Loop Trail that is immediately south of Almerton, down to 126th Avenue, and it's in the DOT plan. So that's why it's one of the first segments that we're working on.
27 is a grant application with the United States Department of Transportation. This is a grant project for Joe's Creek Trail and Channel Restoration Project. You can see we've got the cost breakdown below. And so this allows us to apply for various grants. Item number 28 is an agreement with Property Appraiser for levying non-ad valorem special assessments. This is for the Hidden Creek Oak Street retention pond and in the unincorporated area. Same thing for item number 29, except this is the second phase of that project, I guess.
One's property appraiser, one's tax
Oh, one's tax collector, one's property appraiser, I'm sorry. Item 30, resolution determining necessity to construct a bridge and drainage improvements. This is for the Beckett Bridge and Riverside Drive, and directing condemnation if necessary to acquire the property and construct the project. Questions on that?
No questions on that?
Not yet, I'm sure.
All right.
Well, and again, on Tuesday, Kelly can go through that, pull project, a map up, and we'll make sure that she's ready, because you want to be able to see that. There's certain areas where, around the bridge that are tight, and they may be able to work those easements out, they may not be able to, but the project needs to move forward, and so,
Commissioner Long?
Is it a county recommendation from staff?
yes.
Oh.
You know, this is our project, but we're going forward with this, so we're saying that we need to construct it, which is everything needed to be able to construct the project.
And she'll have information on potential minimum and maximum amount of property that we would
Joe, you wanna
potentially be
address it?
taking.
It's a small amount, but Joe, go ahead.
I just want to make sure, you hear condemnation, and it's a big word.
It is a
Right,
big word.
and just to be clear, that would be our last resort.
Understood.
We're going to exhaust all voluntary options as we typically do. There is an exhibit, and Kelly will be happy to go over that, but there is a map that you can look at that shows how small, as Barry was describing, how small these actual physical locations are, and they're primarily immediately adjacent to the bridge, either north and south or east and west, with a couple of exceptions. But the bridge is, as y'all know, has been in need of replacement for some time. We gave you a little overview back in August, and we know there's a lot of issues surrounding it, but we need the resolution of necessity so we can move forward.
I think I got a briefing on it my first day as a commissioner.
Well, I'm glad that was the briefing you were laughing about, not the one we did in August.
Further questions? All right, thank you.
Item 31 is a road transfer agreement with the City of Largo. Item 32 is an agreement with Pinellas Park for provide reimbursement towards the construction of a new fire station. Item 33 is increasing the upset limit to an agreement with Frontier Communications this is for our 911 network services. The request of increase is due to unexpected technical issues with legacy firewalls and delays in the crossover from the old network to the new network that have run side by side for a period of time where they're doing that. Item number 34 is an award of bid to Granite Inliner for sanitary sewer rehabilitation in 4 areas. Ridge Oak, Oakhurst, Bel Air Beach, and North Lake Seminole area, $2.7 million. Under 35 is a first renewal of an engagement agreement with WorkNet. This is for the legal counsel.
Under number 36, you all have had an opportunity to read the confidential memo related to that case, and I invite you to contact me outside of this meeting if you have any questions.
37 is County Attorney's Report. 38 is my report. 39 is an appointment to a local planning agency by Commissioner Gerard. 40 is an appointment to the Construction Licensing Board. It's a commission as a whole. And that's it. New business for the county.
Under 41, County Commission new business, we heard about the health equity resolution. We heard about the tax collector's request. And then the last thing, there were 3, is that right, 3 Skyway Bridge resolutions. In the past, you had given me authority to make a decision on Skyway Bridge's illumination requests. The Department of Transportation said that they don't trust me to make that decision. No, the Department of Transportation has said that would not suffice. They want a full resolution by the board. And so we have 3 before us this meeting. We've talked about trying to do resolutions in advance, ones that we think or know are coming. but there was some question about the appropriateness of doing that process. So I think at the end of the day, there will be some that probably don't get done because they're not timely requested to go through the mechanisms of all 3 counties that need to do it. I don't quite understand it, but that's the way it is set currently. I just had a couple things that I wanted to bring to your attention before we break up for the day. Individual office budgets were due last Friday, April 1st. So if you have not done that, please do that as soon as possible so that we can get the information to OMB so they can process. Secure IT training is required for all commissioners and aides. That is due by May 22nd. I wanted to bring to your attention, we have a request, an offer really, by the St. Petersburg Free Clinic for a partnership. We can give you a one-pager, we can send that out, but basically, the St. Pete Free Clinic has offered to do a farm share style event with us. And this is not to replace farm share, it's to supplement farm share. And I wanted to get your consensus on doing it as a county event as we have done farm share. If there's any objection to that. Commissioner Seal.
No objection, but if I might offer that we might contact the group in Dunedin and Clearwater Free Clinic or others to see if they might be interested in joining in the future.
Sure.
Make it more of a comprehensive countywide program.
Which part?
Well, you said this is going to be kind of another farm share location?
Well, this will be, but it was offered to us by St. Petersburg Free Clinic, so we'll be working with them as far as where they want to target geographically. I don't know that we have a set boundary for them, but we'll be working. But before we got into the weeds on anything, I wanted to make sure that the commission was okay with doing it as a similar county event, which when we do it as a county event and not just individuals, that means that communications can assist us with advertising and those kind of things.
And I concur completely. I'm just saying maybe we want to reach out and think of other partners that we could expand this.
Absolutely, we're happy to do that. Commissioner Long.
Yeah, you talked about our office budgets being turned in, and then right after that, you said something about staff, and I was focused on the office budget. I didn't hear what you said.
Secure IT training is required
IT
for everybody. Your staff should have the information on how to do it. It's about a 45-minute commitment of time. You can do it in sections, but if you sit and do it all at once, it's 45 minutes. It is required for all commissioners and staff.
But we just did that, didn't we?
Yes, we did.
We did, but apparently we did it very late.
We did it at the very end.
So,
Now we have to do it again?
yeah,
Right.
apparently.
Phase 2. Okay.
I wanted to make sure that you received the county attorney's memo on her review of event ticket policy, specifically related to the Tampa Bay Rays and other similar entities. I want to make sure you got that. Speaking of the Rays, the administrator and I had a good meeting with the Rays this week. Nothing specific to share with you, but I just wanted to plant that seed in your head that as you're thinking about what our partnership could be, what that means to you as an individual commission vote on this dais. I just think that if you'd asked me a year ago, I would thought there's really no need for us to think about it, but I think that there's at least the realm that I want you to be thinking about what your willingness is to be as a partner, because as we move forward, there will be a time where we might have to actually make a vote. So I just want that running around in your brain. We have not, typically once a year, we do a meeting in the conference room on the 5th floor to discuss 5th floor procedures and policies. We've had a couple little items pop up that we've handled as a one-off, but I wanted to see if, again, something to think about. Are there anything else happening, policies, procedures on the 5th floor that you want to discuss? If you would share that with Nikki, and if we get enough of them, we'll set aside some time to meet in that back room to talk about those things. Anything else for the good of the order?
Commissioner, if you would like, just as a FYI, coming up, we've got a lot, just like today, it was a really full agenda. Coming up on April 21st, we have affordable housing penny update. surface water program update, solid waste rate review and recommendation, CVB strategic plan, penny update, and a legislative update. So we'll be ordering pizzas.
Charlie,
Commissioner Long.
Barry, with regard to the raise, where are we, maybe you talked about this, I don't know, but we were working on a financial picture that you were going to bring back to us. Where are we with that?
I'll brief you at our end on our one-on-ones. What we were talking about before has changed, obviously. With Major League Baseball denying the raise, the ability to do a split season, that changed the game, literally, for both them and for us in the way in which we approach this. So I can provide you an update. Commissioner Justice, overview is really that. It was an introduction. It was kind of laying out everybody's thoughts, but now we're all trying to figure this out together. So it was a good introduction, but I can certainly give you a little bit more in our one-on-ones.
Commissioner Eggers.
On the solid waste rate issue, there were some funds that might be coming our way for Toy Town, and I know we've had a discussion about long-range plans for that site and the 2024 change and all that. Is that can we have a little bit of that conversation?
We will. So we received, we did receive $15 million from the state legislature for that site, focused around youth sports. We both, as long as the governor doesn't veto it. We did conduct an engineering study. We're in the process of reviewing that information. We conducted a youth sports competitiveness study that was presented, but it was very preliminary. So all those things have to come together. So we're working on that, and when it's ready, it'll come your way. But it's likely going to be towards the end of the summer before we get through all of that type of information.
Anything else? All right, thank you for a very good day. We'll see you Tuesday.